A very good morning, ladies and gentlemen. We'll begin the conference in 5 minutes from now. We request all to kindly be seated and please switch your phones to silent mode. Thank you. Ladies and gentlemen, we once again request all to kindly be seated as we are about to begin the conference. Please find a seat, make yourself comfortable. Also, switch your phones to silent mode. To all our delegates who are still standing are requested to please be seated as we are now starting with the conference. We'll begin the conference on an auspicious note by lighting the ceremonial lamp. May we request the esteemed dignitaries present here to kindly light the ceremonial lamp. Kindly light the ceremonial lamp. Mr. Rajesh Bhushan, Padma Bhushan, Dr. Professor K.K. Talwar to kindly proceed for the lamp lighting ceremony, accompanied by Dr. Sandeep Bansal, Mr. Anil Rajput, Dr. Samir Gupta to kindly proceed for the lamp lighting ceremony. Let's begin the conference on an auspicious note by lighting the ceremonial lamp. A round of applause as we now light the ceremonial lamp. We request the dignitaries to please come together for a group photograph, to kindly come together for a group photograph. Thank you very much, and we now request our distinguished dignitaries to kindly be seated on the stage, to kindly grace the stage with their benign presence. Ladies and gentlemen, please join me in welcoming on stage Mr. Rajesh Bhushan, former Secretary, Ministry of Health and Family Welfare, Government of India, and Chairperson, Governing Council, Illness to Wellness Foundation. Can you please give him an energetic round of applause? A very warm welcome to you, sir. Joining him on stage, we have with us Padma Bhushan, Dr. Professor K.K. Talwar, Chairman, PSRI Heart Institute, New Delhi. Kindly keep the applause going as we now welcome Padma Bhushan, Dr. Professor K.K. Talwar on stage. We also have with us Dr. Sandeep Bansal, Director, Vardhaman Mahamir Medical College and Safdarjung Hospital, Ministry of Health and Family Welfare, Government of India. Hearty welcome to you, sir. Mr. Anil Rajput, Chairperson, Advisory Council, Illness to Wellness Foundation. A very warm welcome to you, sir. Kindly keep the applause going, ladies and gentlemen. Dr. Samir Gupta, Member, FICCI Health Services Committee and Director, Cardiac Cath Lab and Metro Group of Hospitals, New Delhi, NCR. Once again, a very warm and hearty welcome to all our distinguished dignitaries. And now, ladies and gentlemen, as a token of appreciation and a gesture of warmth, we'll present a bouquet to our distinguished guest on stage. I request Mr. Anil Rajput to please present a bouquet to Mr. Rajesh Bhushan and extend a floral welcome to him. Requesting Mr. Rajput to now welcome Padma Bhushan Dr. Professor K.K. Talwar. Kindly keep the applause going. Rajput sir to please welcome Dr. Sandeep Bansal sir to please step forward. And we now welcome Dr. Sameer Gupta sir to please come forward. Kindly keep the applause going. Thank you, Mr. Rajput, for doing the honors. Once again, a very good morning, ladies and gentlemen. On behalf of Illness to Wellness Foundation, I, Prerna, extend a very warm welcome to each one of you to the Illness to Wellness Awareness Conference on the theme Heart Care Don't Miss a Beat, being organized on the occasion of the forthcoming World Heart Day. Can we once again start with a round of applause? Let's have some energy in the house. Thank you very much. I'm your host, Prerna, and I'm delighted and privileged to play host to such an accomplished audience. And as a good host should, I would like to thank each one of you for taking the time out and joining us for this conference. Ladies and gentlemen, today as we come together, we are reminded that heart health is not just a matter of medical science. It is at the very core of human life, vitality, and well-being. The inaugural session will set the tone for discussions on the future of cardiovascular care in India, from awareness and patient education to accessibility of treatments, government initiatives, primary health care strengthening, and the critical importance of emergency response and CPR training. And now, to begin this morning's proceedings, I invite on the dais a leader who's been at the forefront of Illness to Wellness campaign, Mr. Anil Rajput, Chairperson, Advisory Council, Illness to Wellness Foundation, to please deliver the welcome address. Can we all please extend a very warm welcome to him on the dais?
Mr. Rajesh Bhushan, former Secretary, Ministry of Health, Family Welfare, Government of India, and Chairperson, Governing Council, Illness to Wellness Foundation. Padma Bhushan, Dr. K.K. Talwar, Chairman, PSRI Heart Institute, New Delhi. Mr. Sandeep Bansal, Director, Vardhaman Mahavir Medical College and Safdarjung Hospital, Ministry of Health and Family Welfare, Government of India. Dr. Sameer Gupta, Member, FICCI Health Services Committee and Director, Cardiac Cath Lab and Metro Group of Hospitals, New Delhi, NCR. Good morning. On behalf of Illness to Wellness Foundation, I would like to extend a warm welcome to all the speakers, participants, and friends from media who have joined us for the conference on heart care. Don't miss a beat on the occasion of forthcoming Heart Day, which is on 29th September. World Heart Day was established by World Heart Foundation and World Health Organization in 1999, with the first official observance on September 24th, 2000. Originally, it was held on the last Sunday of September, but the date was standardized to September 29th each year starting in 2011 to increase global recognition. World Heart Day unites people globally to raise awareness of cardiovascular disease and world's leading cause of premature death. It is important to take a moment to look at some important facts so that we can truly understand why awareness around heart care and cardiovascular disease is so important for the globe. Cardiovascular diseases are leading cause of death globally. An estimated 19.8 million people died from cardiovascular diseases in 2022, representing approximately 32% of all global deaths. Of these deaths, 85% were due to heart attack and stroke. In 2016, India reportedly mentioned that 63% of total deaths due to NCDs, of which 27% were attributed to cardiovascular diseases. It accounts for 45% of deaths in 40 to 69 years of age group. Heart diseases are becoming more common nowadays, and there are several major reasons behind this. And one of the biggest causes is not eating properly, not taking fruits and vegetables in their diet, lack of physical activity, sitting for long hours without exercises, excessive screen time. Another major reason which we can all feel and understand is the stress. In the fast-paced life that we are living today, we are constantly under pressure. Whether it is work pressure, whether it is financial stress, or these days younger generation has many personal life issues. And we have to be mindful that stress also affects the heart over time. High blood pressure and diabetes, high cholesterol level are the other medical conditions which put extra strain on the heart and can lead to serious issues if we don't manage them well. Many things in life we take it for granted. We all get busy in our daily life, and we all do this at the cost of our health. It is important in life to chase your dreams. But while chasing those dreams, if you don't really look after your health and ignore your health, you will realize that all those dreams were really not worth it. Because you can enjoy the benefits of those dreams only if you have good health. So therefore, we have to constantly look at and be concerned about our health. Every day, we find time for everything. And if we don't find time to look after our health, then whatever we are chasing is not really worth it in life. Genetics or family history also plays a role. If someone in our family has heart disease, chances are higher to have heart diseases. Obesity is another key reason. It puts more pressure on the heart and increases the chances of developing other risk factors like diabetes and blood pressure. Post-COVID, we have seen many cases of sudden heart attacks, especially among young and healthy individuals. This sudden increase also has given rise to a lot of confusion and myth in society. People are scared, and sometimes the information they come across isn't always accurate or scientifically proven. Thankfully, today we are fortunate to have with us experts who will help clear our doubts. They will be sharing valuable insights and help us understand the difference between common myths and actual medical facts related to sudden cardiac deaths. We would like to sincerely praise the efforts of Government of India for implementing a wide range of initiatives aimed at the care and cure of heart diseases. These efforts reflect a strong commitment to public health and the well-being of citizens, especially those from economically weaker sections. One of the key programs addressing cardiovascular health is the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke. In short, they call it NPCDCS, focusing on prevention, early detection, and management. This is supported by Ayushman Arogya Mandirs, which promote lifestyle changes and community-level interventions, and Pradhan Mantri Jan Arogya Yojana provides financial protection for advanced treatment of our heart diseases, reducing the economic burden on families. The Pradhan Mantri Jan Arogya Yojana provides health insurance for secondary and tertiary care to economically weaker section of Indian society, and we all need to share this information with maximum number of people so that they can benefit from it. It provides treatment for heart diseases, conditions such as coronary angioplasty and heart bypass surgeries. The scheme offers a cashless benefit of up to 5 lakh per family annually. Several health and wellness movements like the Fit India movement, Khelo India, Har Ghar Yoga have been launched by Government of India to promote physical activity and mental well-being among citizens for helping people maintain a healthy lifestyle for prevention of heart disease. And I think many people of my generation can actually correlate that when we were younger, we used to have play field in the schools, and we will go out and play. Every day a session was physical activity was identified. In our houses where we were living, there were playgrounds. Then after coming back from school, we will go out and play. Unfortunately, today times have changed. Many schools that are there which do not have playgrounds, so children don't have opportunity for any physical activity. Houses have become multi-story houses. Children, when they come back, they only sit in the 4 walls of the house, and the only activity they have is the screen time on their mobile phones. So going forward, these are not good signs. And if our society has to remain healthy, they have to get into having more physical activities, and then only you can keep good and healthy heart. Recently, Honorable Prime Minister Shri Narendra Modi appealed to the nation to reduce oil consumption in daily diet by 10%. A great initiative, a great call to keep our generation healthy for years to come. It is a significant step towards promoting heart health, as cutting down on excessive oil can prevent obesity, manage cholesterol levels, and maintain a healthy heart. Technology, along with artificial intelligence, is playing a vital role in transforming healthcare across the globe. It enables the connection between patients and medical experts from different locations, which helps bridging the gap between rural and urban India. Through telemedicine, wearable devices, mobile labs, and AI-driven diagnostics, healthcare is becoming more efficient, timely, and accurate. In a diverse country like India, the need for affordable and accessible healthcare technology is more critical than ever. With the rising burden of heart diseases, including hypertension and high cholesterol, there is an urgent need to raise awareness and provide people with knowledge of both preventive and curative measures. To address this, the Digital Health Mission is a step in the right direction. It is helping to connect patients with healthcare experts across the country. Through this initiative, people can access medical consultations, health records, and treatment plans digitally, helping especially those in remote or underserved regions. This year's World Heart Day theme, "Don't Miss a Beat," emphasizes the importance of taking every heartbeat seriously by promoting physical activity, balanced nutrition, stress management, and timely health screening. It calls for a holistic, multidimensional approach that considers the social, economic, cultural, and systemic factors contributing to the disease. No disease can be eliminated without collective efforts. The government just can't do it alone. It is our responsibility to support the government and actively participate in its programs. To support the awareness around heart care, Illness to Wellness Foundation is promoting holistic well-being by raising awareness through health education, sustainable hygiene, and lifestyle changes. We are fortunate to have leading voices on the subject in our midst. I am sure that today's discussions will be both engaging as well as educational. I am confident we will have impactful takeaways from the program that will benefit the listeners and contribute towards a better strategy to address the complex topic. As we all know, that today social media is playing a very active role in generating awareness. And I assure you, all the experts who are sitting here, that we would make every effort to share the message that you give to the people, and it reaches to large number of people in our country. Let me conclude with the timeless wisdom of Charaka Samhita, one of the foundational texts of Ayurveda, which reminds us that the heart is the seat of life. Therefore, in safeguarding the heart, we are not only protecting individuals' well-being, but also ensuring strength, vitality, and health of generations to come. Jai Hind.
Thank you, Mr. Rajput, for your inspiring and insightful words that beautifully captures the essence of this initiative. Ladies and gentlemen, this morning we are privileged to hear from some of the most respected voices in the field of cardiology and healthcare. To start with, I warmly invite Padma Bhushan, Dr. Professor K.K. Talwar, Chairman, PSRI Heart Institute, New Delhi, to address the august gathering. Can we please welcome him on the dais?
Good morning, and respected Rajesh Bhushan ji, Shri Rajput ji, and my colleagues Sandeep, Dr. Sameer, fellow participants. First, I must express my gratitude to Rajput ji for this opportunity, and being today is we are taking, celebrating, or we are trying to realize the importance of heart by the WHO Heart Day, and this theme today is don't miss the heartbeat. As a doctor, I'll say that sometimes we do miss the heartbeat. I'll come to it later on. But as far as I think Rajputji has very, extensively reviewed and shared with us the burden of cardiovascular diseases and the possible causes. The few things which I like to share, I think, which I think though he has mentioned, but one more important thing, that 20 to 25% of our heart attacks occur in young people, below the age of 40, sir. And if you compare this with the Western population, it's hardly 5 to 10%. So that's one issue, that younger people, we as are younger people, prone to serious heart attacks. And then it becomes that what are the basic factors which our younger generation is prone to heart attacks. Of course, genetics possibly plays a part, but there are, I think, certain lifestyle issues also which play a part. Smoking in young people is supposed to be the commonest risk factor. We had in our analysis 85% who had heart attacks below the age of 40 were smoker. Of course, then excess alcohol, unhealthy food, these are some of the issues. So I think that's stress part, which sir you have mentioned as one of the factors. Younger people, I'll say this is one of the very, very important risk factor. I think some years back, New York Times even highlighted stress probably is the worst enemy of the heart. I think younger people, because today most of them working the kind of stress working, you have fixed schedules, you have to time-bound kind of, you must contribute this much, you must do this, and particularly working in the corporate, I think can be a stressful time for the youngsters. And then, of course, the issue of losing a job. In the government sector, at least one is very confident, nobody can fire you. Whatever they may be, you are secure. In the corporate, this is one issue. I think as we see young people when they come to us for 30, 40, I say, why are you coming? But I think probably behind them this is also, if they do not do that much, probably there's a fear of sort of losing a job, financial issue, the family issue. And earlier, I think in our culture, so we used to have like combined family. Now they are nuclear family. If they're the husband, wife, they're all busy, they have some kind of differences, there's nobody to guide them. Very few people to guide them around. So I think this is one issue, and I think this meeting being the corporate sector, industry sector host, I'll suggest to Rajputji that I think they should look into this aspect, that how make, to some extent, some kind of a mental security to a person. Because in Western population, if somebody loses a job, I think he gets some money from the government. I was surprised, sir, I went for a fellowship to Sweden, I'm talking of early 80s. So I was surprised, people, younger people, I said, okay, तो सबको पैसे मिलते हैं. अगर वो कोई भी नहीं काम करता है, इतना डॉलर उसको मिलता है, इतना क्रोन स्वीडिश उसको मिलता है. But I mean bear here, if somebody loses, we have no security. There is nobody to help me unless you have some family support. So I think stress, sir, I think there should be. And then, of course, the industrial group should also look at a kind of health and wellness setups. Some exercise places where they can do treadmill, they can do something, some kind of a period for them. I think it is also important because person can be more productive if he is confident that I am safe. Then probably, so that's one issue, sir. I thought to use this platform to highlight on this.
I am also safe, what you said.
Okay, thank you, Jalini. So this is one issue. The second issue, apart from the risk factor that you have mentioned, the dietary, the junk food, the lack of exercises, I like to mention about the exercise issue one thing. I said you highlighted that in schools there used to be playgrounds, and then, so I think, I remember that the child after 4 or 5 o'clock will go to the play field after school time. So today, I think, particularly in bigger cities, I think it is becoming very difficult. What happened in COVID? For 2 years plus, children were sitting at home, and what they were able to do, only looking at the sort of screen. And I think this is addictive. When you see more of children get addicted to it. So I think we need to make sure, I think present time, particularly in big cities like this, the school should be asked on Saturday, school should be open only for sports. So that is the only way children can go and play there and be sort of, otherwise even you have 40 minutes play time, I don't know how much they are allowed go around to the field. So these are healthier kind of ways, not only for the body, but mind also. And always another issue which comes are when stress is how we activate or how educate our younger. We talk about preventive steps like take diet like this, do exercise, but we also have to sort of make them aware of how to handle stress. Because that is also an issue, and I personally, as a medical person, whatever I have learned, I think to teach them spiritual practices. I won't say religious practice, I'll say spiritual practices is very useful to make one realize. Exercise is useful, meditation is useful, do some good to somebody. This sacrificing thing is a great thing for the mind to be satisfied. Do something for the other, help others, share with others. So I think these kind of communication may help the younger people to little see how they handle stress, because of course sometimes and the stress is so much, particularly I think the loss of job or so, that becomes, and they'll get into even bad habits, drinking, bad foods, lack of sleep. So this is one area which I think we need to also stress upon when we are talking of these lifestyle diseases of the heart as such. So when I was studying in medicine, I joined my medical college. I was in 4th, 5th year. So we used to have our teacher will sit and we will sitting around and he will see patient and we will watch him. And that was a way of educating us how you talk to the patient, how you sort of communicate with the patient. And that's why when we talk about these days compassion and all that, this we learned while they were seeing patient in the ward in the OPD. I remember a army officer, young army officer came to the clinic. He came to our professor, Professor Vector was, you may not be there by that time. So he came and he said, कि मेरा heart का beat miss हो रहा. And so this is sometime, and he used this sentence, I'm talking of 70. He said, look young man, after examining him, look young man, it's a sign of health. Now, I as a student, when he used this sentence, because those days when I joined my MD in PGI, we were using quinidine, procainamide, drugs were available for anybody coming with missing beat, you give these drugs. It was in only 1980 that an important article came in New England Journal of Medicine that missing heartbeats can be benign. So I was wondering that person, how wise they were. I'm talking of 70. He said, look young man, now look at the communication. You tell somebody, ठीक है, missing beat है, हो जाता है, normal भी हो जाता है. When you communicate in a manner, look young man, it's a sign of health. It is telling him don't worry at all. So this is a way how when this miss the heartbeat, so I thought I must share this particular thing, that sometimes missing beats can be in a healthy people also, but this theme, the main objective is to make one realize that heartbeat, is very important, and you must try to make it healthy heartbeat. So take all precaution, the heart is healthy, and you don't fall into cardiac kind of issues. Sometime we do talk about, sir, about the sudden deaths. This is again, and largely sudden deaths are because of the heart attack. And that's why now that we must also rely the CPR, what we call cardiopulmonary resuscitation. If somebody suddenly faints or has this issue, if you can resuscitate them very quickly, you may be able to revive him. It has happened. And so that's why the CPR training is another issue which we should try to incorporate into our these health and wellness programs, that everybody I am sitting here should have some kind of training of CPR. And it's very simple, so that way you can save somebody. I can quote you an example, sir, it's a real example. Somebody was driving in Bangalore and he was, people saw, what is he doing? He's trying to, and suddenly hit a tree, and then, so what, he had a heart attack, and that steering hit his chest, which was like a thump to him, and he got revived. So what I mean, sometimes nature can be kind to you in different ways. So this is another aspect I think we should, the foundation should also incorporate the CPR kind of program into their employees, into their so that I think if somebody has, you are there, somebody there to help. And if you can immediately help, that's the golden time. Of course, I mean, you have to quickly get the medical help. Well, I think timing. Thank you so much, sir, for this opportunity, and thank you so much.
Thank you very much, Dr. Talwar, for sharing your valuable insights with us. With due respect, I now invite on the dais Dr. Sandeep Bansal, Director VMMC and Safdarjung Hospital, Ministry of Health and Family Welfare, Government of India. Can we please welcome him on the dais?
Good morning, respected Rajesh Bhushan sir, Dr. Talwar sir, Mr. Anil Rajput, Dr. Samir, ladies and gentlemen. See, the topic is the same, the contents are the same, so there's bound to be some bit of repetition. I'd request each one of you to kindly bear with me, but I'll try to give my perspective about the problem. Though we are celebrating the World Heart Day, yesterday itself, that is the September 25th, we had United Nations high-level meeting which laid impetus on two things: the non-communicable diseases, of which the cardiovascular diseases, including cerebrovascular diseases, are a very, very important component. So it's like 2/3 of the NCDs are composed, or the causes of death are contributed to by the cardiovascular and cerebrovascular diseases. So that's the importance. The second thing is numbers are going to increase. The American College of Cardiology said in some recent papers that by 2050 we are going to have a 90% increase in the burden of the cardiovascular disease. Another thing which has been said, this figure is US, comes mainly from the insurance data, but given the fact that 18% GST has been taken off the insurance, and we look at insurance being more kind of adopted in our country, it becomes relevant to us also. The cost of prevention is 1/6 the cost of treatment. So non-communicable diseases is one part. The other important part is mental health, what was talked about in terms of stress. Dr. Talwar sir would recall the Brownwald that we read. Brownwald is our textbook of, we call it the Bible of cardiology. And that's one textbook that each one of us reads. In the edition of Brownwald that we read, we were told about life change units. Life change units means that your life has been affected by less than 50% or more than 50%. And two things were above 50%. One was job, and the other was your spouse. So maintain a good relation with your boss and maintain a good relation with your wife. That's very important, because although the number of women having heart problems is increasing, but we were taught very clearly, we came from the same institute in Chandigarh, they taught us 9 men fall, only then 1 woman would fall. The percentage has increased a bit, but generally that still holds true. So while there are so many new stresses, these two still stand tall. Maintain a good relation with your boss, that's a good sign, a road to good health. So as a prelude to this United Nations high-level meeting, this was the 4th meeting, which was held in 2025. The first one was held in 2011. At that time, I've headed the cardiology of Safdarjung for close to about 14 years. So at that time, the government of India had invited people in Vigyan Bhavan to, as a prelude to that first meeting, to seek suggestions. So this time around, since there was no official invite, I thought we would take it up, and at Safdarjung, we had a meeting wherein we called people from all concerned specialities, which would include cardiologists, nephrologists, neurologists, community medicine people, medical oncologists, like that, to make some very simple, suggestions. So one of the very important risk factors, in fact, the most important risk factor, is hypertension. So the United Nations says that we should try to achieve, achieve a 50% increase, a 1/3 increase in the control of hypertension by 2030. And we should try to decrease this burden by 1/3 by 2050. It's a phenomenal task. So we said, how can you do that? See, at the ground level, this again has been talked about, while the government involvement is important, the involvement of the private sector is extremely important. But that, because at the present time, about 40% of the healthcare is catered to by the government and 60% is catered to by the private practitioners, including, very importantly, the standalone practitioners. So how do you go about it? We suggested, we all know, sir, combination therapy is the way to go about in terms of hypertension. And worldwide, it has been recognized that for managing hypertension, you need at least 2 drugs. There is also an increasing school of thought which says that half doses of 2 drugs, or 1/3 doses of 3 drugs, or even 1/4 doses of 4 drugs can be the starting treatment for anybody. So we said, let's sit around, decide that you have a half-dose combination pill and you have a full-dose combination pill, which can be given by the most peripheral doctor in an easy manner. That would have a universal application. That is what we suggested. We said the most important, there are 2 problems with the mental health. First thing is the budget for mental health is low. I'm deviating a bit, but I think it's extremely important because mental health is extremely important contributor towards cardiovascular health. Of the total health budget of the country, only 1% is spent on mental health. That 1% amounts to about 1,050 crores, of which 800 crores goes to one single institute, that is NIMHANS. So we need to increase our support for mental health. We also need to increase our acceptance. If we have a raise of hands as to how many people have sought help for mental health issues, there would be no hands raised. Okay, there's one hand raised. So the fact of the matter is, I was talking to my colleague who is the head of psychiatry, and he said, Sandeep, if you want me to count on fingers how many people I have treated in the hospital, you'd be surprised. The fact of the matter is, we are not forthcoming. That is because of the stigma. So we said the government should have very simple slogans. आपकी मानसिक परेशानी आपके शारीरिक रोग से भिन्न नहीं है. If we propagate that, there will be a greater acceptance towards. So those are the root ways in which one goes and helps the people. The third thing, a lot was said about younger people getting affected. Almost 14 or 15 years ago, there were two guys in Britain. They were public health specialists, Wald and Law. They gave the figures that 85% of heart attacks in the UK occurred above the age of 55. And there was a bit of cajoling in the press which said that statins should be distributed in water, especially to all the people who are more than 55. And so I was in the ministry, and the then secretary just was again joking. He said, Doc Sahab, why can't we do this in India? To everybody who's more than 55, we give a statin. So there were several other heads of the department in the meeting. They must have heard it. I came back and told a young lady who was my senior resident, I said, you pull out the data for last 2 years from Safdarjung Hospital and see what was the age distribution of heart attacks presenting in Safdarjung. We presented it at the Cardiological Society of India the subsequent year. Believe you me, 3,500 patients data, 60% of our patients were less than 55. Dr. Talwar sir talked about patients' percentages below 40 years. I'm talking about below 55. So 60% of our patients were below 55. Our diseases start very early. We also suggested to the government in our program that we should start with schools. I volunteered by saying that Safdarjung would adopt 14 schools around their area. It's a question of 1 hour every month. So one person from each of the major specialties goes for 1 hour and talks to the people who are in the very index classes, 9, 10, 11, 12, or 10, 11, 12, like that, so that the children are able to, we are able to affect that at an early age. There's another aspect to this also. 2 days ago, I was in a kind of teet-a-teet with one of the union ministers, and I was telling him, sir, 13 years ago, we presented a paper at EuroPrevent, which is the preventive cardiology meeting of the European Society of Cardiology. And we showed there, we measured the echo, ECG, and the sugar and electrolyte parameters of 30 children, at least one parent of whom was affected by diabetes or hypertension. And we compared them with another 30 children whose parents did not have diabetes or hypertension. Though the patients, the children of affected parents had their values still within normal limits, but they were statistically significantly more than the patients whose parents did not have it. So I said, sir, for See, we talk of prevention, I don't know, but let me tell you, there is something called primordial prevention, which means you prevent the risk factors. There is something called primary prevention, which means that we have risk factors. I have diabetes or hypertension, and you're preventing coronary artery disease in me. That is primary prevention. So I said, sir, this would act as a secondary prevention for the parents, and it would act as a primordial prevention for the children. So the Honorable Minister said, Dr. Saab, I don't agree with you. It's the mothers who, for their convenience, feed their kids the bad food. And that's a fact, matter of fact. How do we tackle this? What the government can do is, when you can tax the cigarettes, you can certainly tax the burgers. When Trump puts a 50% tax on us, why can't we tax the pizzas and the burgers and the McDonald's and all those things? A higher tax would certainly act as a deterrent, because if we continue to eat these ultra refined foods which have become the way of life for our younger people, we are looking at doom. We all need to do that. A lot has been said about physical activity, and we actually need to get our heads together as to how to implement mandatory physical activity. What some governments have done, so Australia has banned mobile phones in the schools. South Korea has done that in about a week back. And there's absolutely, it is time that both the governmental, the voluntary, and the other efforts are undertaken to prevent this scourge of cardiovascular diseases. I can go on and on, but I think I've said enough. I wish this meeting the very best. And I think let's all put our hands and heads together for the better future of our country. Thank you.
Thank you very much, Dr. Bansal, for your insightful words. And now it is my proud privilege to invite Mr. Rajesh Bhushan, former Secretary, Ministry of Health and Family Welfare, Government of India, and Chairperson, Governing Council, Illness to Wellness Foundation, to deliver the keynote address. Can we extend a very warm welcome to him on the dais?
A very good morning to all of you. Honorable Mr. Anil Rajput, Chairperson, Advisory Council, Illness to Wellness Foundation. Padma Bhushan, Honorable Dr. K.K. Talwar, Chairman, Fortis Escorts Heart Institute, New Delhi. PSRI, Heart Institute, New Delhi. Dr. Sandeep Bansal, Director, Vardhaman Mahavir Medical College and Safdarjung Hospital, Ministry of Health and Family Welfare, Government of India. Dr. Sameer Gupta, Member, FICCI Health Services Committee and Director, Cardiac Cath Lab and Metro Group of Hospitals, New Delhi. Ladies and gentlemen, it's indeed a pleasure to be here. What you have heard so far and the people that you see seated on the dais are the luminaries in the area of treatment of these diseases. But you would have noticed that they also talked of promotion and prevention, which is the key for all chronic diseases, for all non-communicable diseases, including diseases of the heart. And prevention and promotion starts from the school, from young age, from our families, what our teachers tell us in school, what our parents tell us in families, and those are the habits in terms of physical activity, in terms of eating, in terms of our philosophy towards life that we inculcate, and then they get reinforced over a period of time. आप ये नहीं कह सकते कि मैं तो बड़े टेंशन में जी रहा हूँ. You should be asking yourself कि मैं इस टेंशन में क्यों जी रहा हूँ. It is not government, it is not the corporate world, sorry sir, that has given you that tension. It is the way you've been brought up in your family, in your schools. Let me concretize this by giving you a very specific example. When I was in school, my teachers, and mine was a day boarding school, so we used to go early in the morning, around 7:30, would come back at 5:30 in the evening, would have our breakfast, lunch and evening tea in the school. So our teachers used to tell us, and most of them used to tell us, that life is a marathon. Life is not a 100-meter sprint. So therefore, if life is a marathon, you need to have patience. You need to have perseverance. There would be obstacles. You must be patient enough to overcome those obstacles. This philosophy in the last few decades has just ceased to exist. The teachers tell you, we'll talk to you, over tea maybe. Yes. So, you have, sort of disturbed my chain of thoughts. So I was saying that the teachers used to tell us that life is a marathon, patience, perseverance, obstacles, you need to overcome the obstacles. What happens today? We are told that if you are inclined towards the medical field, prepare for NEET UG, leave everything else. Once you have obtained your MBBS degree, forget bedside learning. वो तो बाद में देख लेंगे. Prepare for NEET PG. So, what do you end up with? You end up with tensions. You end up with all kind of problems. It leads to early burnout. Early burnout अपने आप में नहीं होता है. There are specific triggers that lead to this early burnout. And there is no one to guide these young people that this is what you should not be doing to prevent an early burnout. So, the entire ecosystem needs to change. Doctors का रोल तो बहुत बाद में आता है. In fact, Dr. Sandeep Bansal has been gracious enough to say कि जो हमारे PSM departments हैं medical schools के, या जो हमारे community health department हैं, they should adopt schools, they should adopt villages, which they in any case are supposed to do. That is their mandate. Again, but that's discussion for some other day. Coming back to this topic, so what transpires in our families and our schools becomes very important. And we need to now reinforce among our children the fact that putting in hard work and hard labor in intense bursts for short period of time for desired results is not the way forward. Why is it that in Japan you have more than 100,000 people who are more than 100 years of age? Because they do not believe in this philosophy of intense bursts of work and then getting desired results. They believe in the marathon philosophy. So that's one. The second thing, again I am talking from my example of my own school. Why is it that our school canteens still sell in an unregulated manner? I am not going to the extreme example that Dr. Bansal gave, although there are merits in that example also of taxing certain kinds of food. But look at our school canteens, all public school canteens. Who's regulating the food that is being sold there? No one. You bid it out and you say that Ramdas, Shamdas, Haridas is the L1 bidder, therefore this canteen would be run by either Ramdas or Shamdas or Haridas. And what do they sell? They sell deep fried samosas, maybe that oil is boiling from morning till afternoon, and multiple samosas are being, nikaloed from that same oil. it leads to creation of a chemical called acrylamide, but that is a carcinogen. We will discuss that on a separate occasion. So, there are scientific studies which prove that, and this has been done in Delhi, that mere placement of food items in a school canteen guides the choice of kids of what they would eat and what they would not eat. Suppose as a kid I go to the canteen, am hunting for a samosa, that samosa is not visible easily, something else is visible because that is placed in front of the counter, I would end up buying that. Therefore, this is, this gentleman globally got a Nobel Prize for this, the nudge theory. This is nudge theory. You are nudging that young kid to buy maybe a millet cookie which is displayed in front of the counter rather than a samosa which is at the back. Nothing stops us from doing this as teachers, as principals. Certain schools now even have medical officers in school. So food choices can also be governed. Now I have talked to you about two things. One, the choice of philosophy you need to adopt in life going forward. Two, the choice of food that again gets determined from school and from your families. Rather than going in for 2-minute solutions, you can go for other alternative food solutions for the kids. The third very important thing is physical activity. I remember when I first joined Government of India, Ministry of Health as a young director, at that point in time I never thought I would become secretary in the same ministry. From 2000 to 2006, no one was talking of physical activity in the health space. And then suddenly, in I think 2003, the World Health Assembly in Geneva decided to discuss something called the WHO strategy on sugars and physical activity or something. So suddenly everyone also woke up in the Union Ministry of Health, Government of India, and they said physical activity mein kya karna chahiye. So we had a brainstorming where doctors from Lady Hardinge Medical College, from Ram Manohar Lohia, from Safdarjung, from AIIMS New Delhi, from PGI Chandigarh, from JIPMER Pondicherry, because these were the prestigious government colleges. So they were all invited, and for the first time it became something to be discussed. So coming back to this element of physical activity, again this is something that gets determined in the family and in the school. How much importance are we attaching to physical activity? Nothing can be done by forcing things. I cannot force kids that you must play. But I must say that it is not very important whether you are in the first 5 in the class academically or not. The moment as a teacher or as a school management, I send this signal, my kids will start singing, dancing, playing, swimming, cycling and what have you. But from day one I am saying you must top in the class. If you are unable to top, you must come at least in the first 5. So there goes your sports and there goes your physical activity. Once you are 50 plus, then the doctor tells you triglyceride bada hua hai, hypertensive ho, then you say, okay, now I'll do morning walk. But what about the historical deficit? How do you compensate for that historical deficit? And this is again an attitudinal problem, in the sense that we do not have a health-seeking behavior. And this is something which this foundation and other non-governmental bodies and medical colleges must do. खांसी होती है हम कहते हैं ठीक हो जाएगी, बुखार होता है हम कहते हैं वो भी ठीक हो जाएगा. So there is no health-seeking behavior. We do not seek a doctor. Mental illnesses तो बहुत बात की बात है, because there is a stigma attached. खांसी और बुखार के साथ तो कोई स्टिग्मा नहीं है, वहां भी हम we do not seek medical care. So this then accentuates the problem. The last thing that I want to share with you is that when you have a country like India, 140 crore, which is suffering from dual burden of disease, you have communicable diseases on the one hand, TB, malaria, dengue, chikungunya, so on and so forth, and you have non-communicable diseases on the other hand, then the focus always historically in such epidemiological settings has been on communicable diseases, less so on non-communicable. Mr. Anil Rajput was referring to the National Program for Prevention of Cancer, Cardiovascular Diseases and Stroke. This program was formulated in 2010. Imagine. 2010. उससे पहले हम बात नहीं कर रहे थे इसकी भारत सरकार में. But it is not as if Government of India was ignoring it. You see, you must keep in mind the historical context of your country. When you have people and hundreds of people dying from TB, from malaria, from dengue, where is the time and resources to talk of cancer and other chronic diseases? Now that you are on the verge of eliminating, and you have eliminated large number of communicable disease threats, this is the opportune time to invest time and money into looking at non-communicable diseases, including cardiovascular diseases. So it is a whole package approach which has to be followed to see that we proceed ahead, where the government has to work with the non-governmental organizations, doctors have to work with the social workers and sociologists and other like-minded people. Schools have to change in terms of the kind of philosophy that they teach to their students. Families have to change. Let me again, before saying thank you to you, give you some very interesting example which just came to me. During our times, when we were kids, if there was a obese kid, the parents always said ki tandurust bachcha hai. Or if they were anglicized parents, they would say pleasantly plump hai. Hare, so there's absolutely no appreciation of the fact that you need to tell that kid to mind the health. Who would tell that small boy or girl? It has to be the parents. So as a parting shot, I wanted to share this with you. Maybe in certain parts of India, this attitude still prevails of being pleasantly plump and tandurust bacche. We need to come out of that mindset, and there is hope. If all of us work together, we would definitely not only ensure better health, but better well-being of our population. Thank you.
Thank you very much, Mr. Bhushan, for your remarkable address, very relatable and very practical. To conclude this inaugural session, may I now invite Dr. Sameer Gupta, member, FICCI Health Services Committee and Director, Cardiac Cath Lab, Metro Group of Hospitals, to share the concluding remarks. Can we please welcome him?
Thank you so much. Members on the dais, Anil Rajput ji, Chairperson of the Advisory Council, Illness to Wellness Foundation, Professor K.K. Talwar, Chairman of PSRI Heart Institute in New Delhi, Dr. Sandeep Bansal, Director of the Vardhaman Mahavir Medical College and Safdarjung Hospital, and Mr. Rajesh Bhushan ji, former Secretary, Ministry of Health and Family Welfare, Government of India. And he's also the Chairperson of the Governing Council of Illness to Wellness Foundation. And of course, dear friends, we are gathered over here for a very important discussion of the World Heart Day, regarding the World Heart Day, where the discussion is on don't miss a beat. And we've heard some very important points and some very interesting thoughts come out of the previous speakers before me. I think Anil Rajputji talked about the global burden of cardiovascular disease in India. He talked about 27% of deaths in India are because of cardiovascular diseases. He touched a little bit about the Arogya Mandir, some lifestyle issues, and how our Prime Minister also recognized this and said we should reduce the consumption of oil by 10%. And I think that was a very forthcoming point by our leader. Dr. Talwar talked about how younger people in India are having heart disease, and this is something that we also see in our clinical practice. You know, when doctors come from abroad, they come and see our patients, they come and see some of the work we do. And, you know, we had just recently a doctor came from Italy, and he was seeing the angiography and angioplasty cases, and he said, Samir, most of your patients are in the 40s and 50s. Most of my patients are in the 60s and 70s. So I think that is just a reminder of the burden of disease that we have in our country. He also touched upon the importance of CPR, and I think I'll just talk about that in a minute. Dr. Bansal gave some very interesting thoughts about his experience from Safdarjung Hospital. One very important thing he talked about was in his practice where 60% of heart attacks at Safdarjung Hospital, which is a premier institute in the country, were in people less than 55 years. That is 55-year-old person is a contributing member to society. He's working, he's children, teenagers, whatever. He's got older parents. So an illness to him doesn't affect him only. It affects him or her for that matter. It affects the entire family. And we kind of have to recognize that as well. And Rajesh Bhushanji, of course, many of you may not recognize him because when he walked in the COVID time, let me just give a quick anecdote. In the COVID time, every day when there was a briefing by the health ministry on the COVID cases, it was Rajesh Bhushanji who took us through COVID. So thank you very much, sir, for your entire contribution that you did. He would give the briefings and he would be wearing a mask, so most of us cannot recognize him. Sir, in fact, you may not remember, as a member of FICCI, of the PhD chamber and Nat Health, I often visited you, but we were all wearing masks, and you were very cooperative and very forthcoming in helping us out in, whether it was oxygen, medicines, and, coming up with policies together. But, as we bring this session to a close, I want to reflect on what we've heard on this morning, right? We've touched about all these different things. But from a policy perspective, India has taken remarkable steps in the last decade. There have been some very good initiatives by the government, which the foremost is the Ayushman Bharat Pradhan Mantri Jan Yojana, or the PMJY. And this has expanded access to secondary and tertiary care for millions of families. As a practicing doctor, you see patients who come from tier 2, tier 3 towns. Some cost of an angiography in most hospitals is anywhere between 10 to 20,000 rupees. That may not be a lot of money for some of us sitting in this room, where, in the Meridian, in a fancy hotel in this part of Delhi, 20,000 rupees is a dinner for 4 or 5 in a restaurant over here. But for somebody who's coming from a tier 2, tier 3 town, this is a lot of money. It's a monthly wage. And getting them to do the angiography, getting them access to that healthcare, PMJY has played a very, very important role. And I think that has really expanded the access of healthcare to a lot of people. The health and wellness centers under this Ayushman Bharat Yojana that are being designed to provide early detection, preventive care, and management of chronic diseases is also something which is fantastic, and it's a step in the right direction. We also touched about the National Program for Prevention and Control of Cancer, Diabetes, and Cardiovascular Diseases and Stroke. And this has been a key framework in integrating screening, capacity building, and health promotions even at a district level. And this, along with Ayushman Bharat Digital Mission, is really going to expand the access of healthcare to remote corners of the country. But the thing is, policy is not enough. What we need is a convergence. We need a convergence between clinicians, policymakers, technology innovators, and civil society. For example, can we expand CPR, right? Can we make CPR training mandatory? I'll give you a small example. Last week, there's a friend of mine who lives in America. He lives in Orlando, and he went to the gym, worked out, everything, very healthy guy. He has a very strong family history of heart disease, eats right, does everything. And an hour later, he was, taking a shower, and he had a cardiac arrest. And there was a person over there who was a medical professional. He immediately attended to him on the spot. The gym had an AED machine. So they put the AED machine. He was having ventricular fibrillation, which is a very bad rhythm in the heart. They shocked him. They got him back. He went to the hospital. His LAD was 99%. He had a stent placed, and he was fine. So what saved him? We've talked a lot about prevention, but we also have to understand what can we do when disaster strikes. And for that, apart from just education and awareness, we also need these equipments, and we need to have these policies that AEDs and other life-saving equipment should be present in places of mass places. The other thing from a policy perspective is how can we integrate AI-driven tools? Now, AI is here to stay, right? It's not something which is going anywhere. We have ChatGPT, Gemini, Claude, Grok. We have all these different things. How can we incorporate them in our workings, in our medical practice, in our primary prevention? Can they play an important role? And the way I foresee this is, I think it is going to help democratize to a certain extent the quality of medical personnel. Right now, one of the challenges we face is that the quality of medical personnel may vary from point A to point B. Somebody who's practicing in a remote part of the country may think very differently than what the dignitaries on the dais are thinking as cardiologists. So I think AI is going to help democratize some of this to a large extent. And the other thing is, can we align insurance and reimbursement policies to cover preventive cardiology? Every day we see patients, they come, they say, you know what, I want to get my heart checked up. And you tell them a flurry of tests, some blood work, maybe an ECG, maybe an echocardiogram. And the next question they ask is, I have this XYZ policy, can you admit me and can I get it done under that? Because my insurance does not cover preventive and outpatient therapies. So can we try and go down that road as well? I think the GST reform has really made health insurance and life insurance more affordable, and I think that's a step in the right direction. But there's a lot more that we can do. So as doctors, we often see the tragic late stages of heart disease, but policy will give us a chance to shift the curve towards prevention, early detection, and community empowerment. So on this World Heart Day, let us remind ourselves that every life saved, every hospitalization prevented, every child educated about healthy living is a victory for our nation's health system. And I would like to thank the Illness to Wellness Foundation for curating this platform, the distinguished colleagues over here for the vision, and to each and every one of you for this commitment. So together, let's ensure that heart care, don't miss a beat, is not just a slogan, but a roadmap for a healthy heart for the future of the country. Thank you so much.
Thank you, Dr. Gupta, for your admirable summarization. We'll now present a token of gratitude to our distinguished dignitaries on stage. I request Mr. Anil Rajput to present a memento to Mr. Rajesh Bhushan. Let's all together thank our distinguished dignitaries for sparing their valuable time and sharing their expertise with us. We'll now present it to Padma Bhushan, Dr. Professor K.K. Talwar. Sir, to please step forward. Kindly keep the applause going, ladies and gentlemen. Dr. Sandeep Bansal, sir, to please step forward. Dr. Sameer Gupta. And we now request all our dignitaries to please come together for a group photograph. Kindly step forward and come together for a group photograph. Once again, a round of applause. Ladies and gentlemen, with this we conclude the inaugural session. We once again thank our esteemed dignitaries for joining us for the inaugural session, and we request you all to please remain seated as we'll now begin the first session, the first technical session of the day, We'll quickly prepare the stage in next 30 seconds. So we request you all to kindly remain seated and please switch your phones to silent mode. We are starting in next 30 seconds. Our first session, technical session on the theme Emerging Trends of Heart Attacks in Current Scenario, Myths versus Facts. Our upcoming session will shine light on some of the most pressing concerns of our times, the rising incidence of sudden heart attacks and cardiac arrest in young adults, post-COVID complications, the impact of vaccination, the use of supplements and steroids, increasing cases in women, reliance on internet-driven self-diagnosis, and of course the alarming effects of environmental pollution on heart health. This is all we aim to discuss in our upcoming session, and our stage is almost set. Once again, requesting all to please remain seated as we are now starting our first technical session. Ladies and gentlemen, please join me in welcoming on stage the esteemed moderator for this session, Dr. Sunil Khetarpal, Deputy Director General, Association of Healthcare Providers. Can we all please welcome Dr. Sunil Khetarpal on stage? A very warm welcome to you, sir. And now it gives me immense pleasure to welcome our distinguished panel of experts. We have with us Dr. Bipin Kumar Dubey, HOD Cardiology and Principal Director, Interventional Cardiology, Max Dwarka. Can we give them a more energetic round of applause, ladies and gentlemen? Dr. Vinayak Agarwal, Senior Director and Head Clinical Cardiology, Fortis Hospital, Gurugram. Kindly keep the applause going. Dr. Amit Malik, Director, Intervention Cardiologist and Electrophysiology, Medanta Hospital, Noida. Dr. Pallavi Kawatra, Franchise Medical Head, Cardiovascular, Novartis. Dr. Pankaj Ranjan, HOD Cardiology, Yatharth Hospital, Noida and Greater Noida. Can we once again welcome our esteemed panelists on stage? Thank you very much for joining us. And I now hand over the session to esteemed moderator, Dr. Khetarpal, for further proceedings.
A very good morning. I think it is afternoon now. A very good afternoon to all. And, this is going to be a very unique session because I have an esteemed, panelist with me. They're all subject experts, but I, as a layman standing here as a moderator, I mean to say that I'm a layman moderator, not being a cardiologist, but of course I have been an administrator throughout my life, more than 35 years of experience in healthcare. And currently I'm associated with the AHPI, that is Association of Healthcare Providers India. And we represent majority of private healthcare institutions in the country. We have 15,000 hospitals as our members. And we are mainly into policy, advocacy, and capacity building. So, once again, a very warm welcome to you in this session. And it's an immense pleasure to welcome all of you to this important session on emerging trends of heart attacks in the current scenario. That is myths versus facts. This is being organized on the occasion of World Heart Day, which falls on 29th September, and the theme is don't miss a beat. I think, we all know that cardiovascular disease continues to be the leading cause of mortality worldwide, and our country is no exception. What is particularly worrying us is the shifting profile of heart disease, from being largely seen in older adults and now affecting the younger age group. We are seeing heart attacks in 30s, 40s. Every other day, you see in the newspaper, young age, 20s, 30s, 40s, people are having heart attack and dying. It's not only the sedentary lifestyle, stress, changing dietary habits, tobacco use, and environmental factors which are contributing to the heart disease. But at the same time, what is important is the myths and conceptions about heart attacks, whether they affect only the obese, whether the chest pain is the only symptom or the warning sign, or whether women are naturally protected from heart disease. This often delays the recognition of heart disease, because early recognition is very, very important. Early recognition, early detection, awareness of risk factors, and proactive lifestyle choices can make a tremendous difference. So today's discussion, we are going to explore the trends, the truths, and the myths in a very practical and evidence-based way. So our panel of experts will help us separate the facts from the fiction and highlight the new advances in prevention and treatment. Most importantly, guide us on how individuals, families, and communities can take charge of their health. So, I have an advantage of being a moderator, so that I can walk, I can come to the podium. And because it says that sitting for 1 hour is like smoking 1 cigarette. So that advantage I have got. Now, my first question is to Dr. Pallavi. Dr. Pallavi, just to talk on the trends and epidemiology of the heart diseases. So they are becoming more common in younger age groups, as I just mentioned in my opening remarks. And as compared to, 2 decades ago, we were talking of, heart disease only a disease of old age. And how has the profile of risk factors for heart disease changed in recent years, especially in India and other developing nations?
Thank you so much for the question. First of all, thank you so much for letting me be on the dais. I'm also not a cardiologist. But I think that's a very important question for us to actually retrospect and reflect. While doing MBBS, what I learned and what I was told was always look at ABC, which is your diabetes, your blood pressure, and cholesterol. Now, out of these factors, although they've always been in the mind, are we able to implement, are we able to actually detect them in a timely manner and manage them? That's the first question. The second question, what has changed? I think Dr. Samir gave an example of a person collapsing in a gym. One of the biggest myths is being fit does not mean being healthy. Indians are different. South Asians are different. Two things that I want to really emphasize on. South Asians have a concept of thin fat Indians, which is very, very important. So visceral obesity is specific to us. We may have a low BMI, but we may still have obesity, and that's important to know. And hence, screening becomes an important parameter, because you have to know what your lab tests are showing, and you have to know whether they are in the correct range or not. And that brings to the second point, which are the silent killers. Diabetes eventually will come with symptoms. You'll have complications, but you want to detect it early. Some patients may not have symptoms of hyper or a hypo, but you need to detect, and then that's why the testing is important. Blood pressure comes with symptoms. You get headaches. Cholesterol, absolutely nothing that will happen unless you end up with a heart attack. So the question is, are you testing yourself for this? And are you identifying these risk factors at the right time? So I think that addresses the question.
Yeah, good, wonderful. My second question is to Dr. Vinayak. Dr. Vinayak, this is on the lifestyle and risk factors. So is it true that the heart attacks only occur in people who are obese or visibly unhealthy? And how much does the stress contribute to heart attack, and also the sedentary lifestyles play, which compared to the traditional risk factors like hyperlipidemia and diabetes?
So I don't know where to begin actually about this complex question. I mean, the complex problem of coronary artery disease in Indians. especially in the young. So let's look at who we are. As Indians, we are 140 crores. So out of which 737 million are young individuals between the age group of 15 to 55, 60 years of age, which is what is known as the working, say, workforce of a country. Numerically, which means that about 74 crores or so would be young people in our country, which is almost twice the population of US. And numerically, we will have more heart attacks, etc. in our country simply because we are young. Our average age of India is 28 years. But having said that, why would somebody at 25 or 30 years of age get heart attack at all? They should not. They are at the prime of their health. And why is it that? So let me take you back to 2004. There was an inter-heart study which was published by Salim Yusuf in, in a prestigious journal. And they told that in South Asian, especially Indian subset, you get a heart attack or say coronary, the CVD, cardiovascular diseases at 53 years of age versus 63 years of age in the Western countries. So this is not a new phenomena, but I think the epidemiological shift has now gone further down. So you're seeing more and more people in their 30s and 40s getting heart attacks, and I think that is worrisome. What has changed? We have changed. We have changed in terms of what we eat, what we think, what we do in our day-to-day lives, when we sleep, when we get up, what are my ambitions, who am I, or who am I becoming? And I think that has changed. And that's not something which can be sort of tabbed or captured in trials. It's as our previous speaker said, that it's an attitudinal change. So let's take a 25-year-old gentleman today who's working as an executive. Since the age of 3-4 years of age, they are now subjected to junk food, right? Like you have these, the junk food which is available freely in the market, that is given to them. By the age of 20 years, they've already had an exposure of 20 years of that kind of a junk food. Now, if you're going to sell a burger for 20 bucks, you will have to be using very substandard food items, including palm oil, palm oil, etc. Reheated oils, I'm sure, will contribute equally bad. Now, the other aspect is, when do you sleep? Most of the youngsters are sleeping at 1 to 3 a.m. in the night. There's a lot of screen time that you're looking at. Hardly anybody has physical activity. If they do, they're doing extreme physical activities, and we know that one of the risks for sudden cardiac death is extreme physical activity. Because you're pushing yourself, eventually the heart attacks and strokes will occur when there is a plaque rupture in the coronary arteries or in your brain arteries, or there is a clot formation. And this hyperinflammatory response will always be elicited by anything that you do in extreme, whether it is food or whether it is exercise. So you have this fad about doing half marathons and marathons when people who are not even gearing for it. I mean, they start about 3 months before an event, and that's the way they go about it. Now, why is it that people from Kenya and Ethiopia are world Olympic winners in long distance runs? Why is it that they don't have better facilities than Europeans or Americans? Yet they are, in marathons, you would always have Kipchoge or somebody who's winning the marathon. The reason is that genetically we have two DNAs. One is my normal DNA in a cell, and the second is what we call as a mitochondrial DNA, which is different from each of us. So if somebody is in Iceland, can survive in minus 20 degrees with a t-shirt, but they can't survive in our weather of 45, 50 degrees. The reason is the mitochondrial DNA, or what we call as the powerhouse of the cell, will determine your genes. And it keeps changing, it keeps evolving according to the environment. And if you look at somebody like, in Africa, they can run for 30, 40 miles because they were predominantly in a Sahara, sort of large fields which are available. So they're used to walking 30, 40 kilometers a day. So they can run. They're fast, and the slow and fast muscle fiber distribution is different. Their hearts are different. Their muscle oxygenation and anaerobic and aerobic respiration is different. So when you try and emulate somebody who is born to do what they're supposed to do, and you go against your basic nature and genes, that's when you start hurting yourself and getting injured. And I think that's probably summarizing where we are going wrong, is we don't know who we are. And I think we're following all the wrong things. We're not doing basic exercises, basic 5-kilometer walk, or say 45 minutes of exercise per day. We're not eating right, so more fruits, veggies, colors in my diet. We're not sleeping well, at least 6 to 8 hours of sleep every day. We are hyper ambitious, which means we want to get more things done very quickly in our lives, not slowing down, don't have a philosophy to get by in our lives. And I think everything is contributing to why we're seeing this deluge of young patients falling ill.
Yeah, thank you, Dr. Vinayak. I think what you mentioned is the behavior and the discipline, what we need to inculcate in our daily life, because the behavior is very important. You know, the what time, what your eating habits, your choices, and your sleeping pattern, your sleep hours. So all these matters. And of course, the discipline in life, which covers everything, you know. What time you sleep, what time you get up, what do you eat, what do you think, how do you act. So this is all about discipline. Thank you, Dr. Vinayak, and very valid statement. Now my next question is to Dr. Dubey. Dr. Dubey, I worked with him in Delhi Heart and Lung Institute when I was the COO at DHLI, and Dr. Dubey was there. Dr. Dubey, this is something on the gender and demographics. You know, there is a perception that women are less prone to heart attacks. वैसे भी incidents अगर आप देखेंगे तो women में बहुत कम होते हैं heart attacks. ठीक है, as compared to men. And is this a myth or reality? And secondly, do symptoms of heart attacks differ in men and women? And is the why women often face delayed diagnosis?
So, thank you for giving us opportunity, and I'm happy to be here. So first question was whether the women are having a less incidence of heart attack. Yes. The reason is the hormonal change, hormones on the females are different. Childbearing women are usually having less incidence of the cardiac diseases, especially the coronary artery disease, atherosclerosis and all. And that's the usual thing. But after menopause, the incidence in heart attack and coronary artery disease gradually picks up in female. And at the age of 60 or 65, it is the same, male and female the same. So that's the one thing. And second part of the questions are whether the women are really picking up this cardiac problem. Yes. In the recent years, the incidence of heart attack and coronary artery disease is increasing in the females. Why? Because there are certain reasons. Already so many of our colleagues have emphasized the change of the lifestyle and other things. So I have to add only 3 things about that. One, the recent years, apart from the workload, the females usually in past, maybe 3-4 decades back, they are homebound, less stress, usually the like joints family, so less stress, less competitive environment, more time to relax, and that's what that reason was there. Now the women are working, so all these work-related stress are same whether they are women or male. And I can say the working women have much more stress as compared to male. Why? They have to balance their work as well as they have to work at home also. They have to take care of their children also. So then they are having the double stress at home, at your working place also. The other things which we were not very much familiar with, the 3 other factors. One, the use of contraceptive pills. So use of contraceptive pills, all this data is saying it is the exponentially increasing. So especially the young women, why this is affecting our heart? The use of contraceptive pills, they are increasing your blood pressure, that's one. And their pills are usually having pro-coagulative effects, means they can form clots in the coronary arteries or pulmonary arteries or in the deep venous and other things. That's the one factor. And second factor is what we are calling as the food behavior. The food behavior of the women are also changing, and not only the alcohol consumption has in last 20 years or 30 years has increased in the females, that's one. Cigarette smoking particularly is the new thing which is coming in the females. That's also a dangerous thing for that. And last but not the least is we can say that the resting time of the females are gradually reducing. So that's what the incidence of the heart attack is picking up in the females. Last month, we have a female, her age was only 32 years, very good looking, absolutely no problem. But as emphasized that stress, what is the stress? The stress of the lady was just the teaching the kids. उसका बच्चा वो नर्सरी में है, A grade नहीं आया. Now she is so much worried. And next time from A plus to B and now less than B minus. And she had heart attack. Extensive anterior wall MI. And this is happening sometimes. So stress, as so many of our speakers has told, that stress is a newer risk factor, we can say. For me, two newer risk factors are there. One is stress. Now everybody is recognizing that stress is a risk factor. Stress, what stress causes? It increases the level of the adrenaline in body, which is causing the stiffness of the blood pressure, increase in the heart rate, and damaging your endothelium and blood vessels and creating atmosphere for developing atherosclerosis. That's one. Not only that, stress also increases the cortisol level in your blood. So cortisol level is increasing, then diabetes, chances of diabetes, hypertension increasing, atherosclerosis is increasing, and the other thing, it also increases the formation of the clots. So the stress is one. One thing was missing in all these speeches was the pollution. So pollution is the newer risk factors, and it is affecting all, male and female. Why the incidence is increasing? The females are now going out of the house and they are working in the different environment, more exposed to the pollutions as the male members. That's why they're increasing. So you know that pollution, what is the PM level 2 or 2.5 we are talking about, the WHO is very particular about that. And they have given the PM level of more than 5 micro per cubic meters of the air is a risk factor of the heart. What about the Delhi? We are having the PM level of 200, 300, 345, something like that. And people like me, who is a totally non-smoker and teetotaler, every person who is living in Delhi, going for the outside walk, they are equivalent to 40 cigarettes in a day. Same pollution level, creating as bad effect as 40 cigarette levels. So increasing that in the females, as I told you, alcohol and cigarette smoking is now increasing and increasing. The same thing, interestingly, 16% of the children less than 16 years of age are now smokers. That's the worst thing. And here the role of government and society is coming. In Europe, no children less than 18, because I have worked sometime in Europe, you know that no children, चाहे आप कुछ भी कर लो, आप कितने भी पैसे दे लो, आपको अल्कोहल नहीं मिल सकता, आपको सिगरेट नहीं मिल सकता. But it is not true in our country. I had a boy, age 16 years, and he came with extensive anterior wall mass, surprising to us. So it's a sick boy. So their parents came to, we are not doing Sikhs are totally not taking cigarettes and others. So we have asked, try to find out why this boy has this, no family history, no other risk factors in the family, nobody had a heart attack any time. So after probing, so we have asked the parents कि ये smoking तो नहीं करता है, वो तो गुस्सा के इतना ज़्यादा गालियाँ बकने लगे कि how we can smoke. So being a Sikh, no chance. But once we kept the child away, take him to the CCU and the ask, and he was a cocaine users, smokers. वो जो आपके आते हैं, and where is this available? It's one of the biggest hospital chain of schools in Delhi, where these type of things are available. So this is our society responsibility, our teacher responsibility, government responsibility to at least stop those type of things. Similarly, the pollution is the responsibility of the government to cut it short. So these are the few things where the females and everybody is increasing this.
Absolutely, absolutely correct.
Thank you,
Dr. Dubey. Smoking, alcohol, hookah bars. आजकल तो आप कहीं भी जाएंगे आपके लिए हुक्का पहले ही वो तैयार होगा कि यू नो so I think he is very rightly mentioned that women are not immune to heart attacks and the incidence of heart attacks in women are increasing because of the various factors which he very rightly mentioned. And one important thing he mentioned was about the environmental factors, the prolonged exposure to air pollution, you know, AQI level, हम दिल्ली में कितने AQI level पे जी रहे हैं, so I think, you know, it is imagine a child who is living at this AQI level in Delhi, so uska long term effect, you know, how is he going to cope up with all these problems? I think, and another thing you very rightly mentioned, laws have to be, you know, stringent regarding this young age ki 12 saal, 15 saal mein drink le raha hai, smoke kar raha hai. So laws are not stricter actually, laws not implemented in letter and spirit. So this is also important. Thank you, Dr. Dubey, for your very valuable insight. Now my next question is to Dr. Pankaj. Dr. Pankaj, this is regarding the early detection and the screening. Now people say that मेरा तो BP normal है, मेरा तो cholesterol normal है, मैं obese भी नहीं हूँ, मेरे को diabetes भी नहीं है, मैं मस्त हूँ, मेरे को क्यों heart attack होगा? Is it true? Is it a myth or is it true?
No, it is not true. Anybody of us can have heart attack. Age is no bar, sex is no bar.
Absolutely.
We have, as sir said, even a 16, 20-year-old boy is getting MI, heart attacks. As far as screening is concerned, every one of us should think, where are we in high risk category? We can always see that if anybody in our family is having heart disease, or our biochemistry is altered, our cholesterol level is high, if I am diabetic, I am a smoker, then you are already in high risk category. The first thing is to assess yourself. Where do you stand? And I think everybody should, I think there is a recent recommendation that everybody who is 18 should check their cholesterol levels. Anybody can have heart attack. They should always screen themselves whether they are in actually high risk category. One more thing is that I want to, everything is being said by our esteemed colleagues. One thing is that everybody is coming to us, many persons are coming to us that they ask whether we should do CT coronary, CT, because it is easily available. There is no strict law, there is nothing. Everybody is, many persons come to us that, Dr. Saab, I have no risk factor, but even then because somebody I know developed heart attack, I want to check my heart, whether there is a possibility in me. They ask for CT coronary. And there is a recent approval from many senior celebrities and many doctors also that everybody should do a CT coronary if they are in high risk category. I think that's a wrong practice. CT coronary is very dangerous. People do develop renal failure. Chronic renal CKD they develop CKD following CT coronary. So my idea is that first you assess yourself that if you are in high risk category, try to do all the things you can do. Don't go for test. In basic, our lifestyle has changed. There is a cultural shift. Our lifestyle has grossly changed. We should try to revert back to our previous. It is not possible, but at least we should give it a try. That we should try to improve our lifestyle. Like we should be more like food. Our life. We should not be using the vehicles very commonly. We should. Basic thing is our lifestyle should be better. There is stress. Second thing is night duties. Anybody who is doing night duties, night duty cannot be physiological, and the night duty should be minimized. And the stress part of it is, as sir has said, stress is. You cannot link only one thing to the stress. Many factors. It is actually imbibed in our culture. From the beginning, we have been raised like that. We are taking stress. So ultimately, the thing which will help us most is change in our lifestyle. We should be very much starting from the early life. Even the kids should be encouraged about adopting healthy practices.
Suppose you have had to prescribe some screening test for early detection in apparently healthy people. So
What would you advise?
The only thing is we can do is if patient is in very high risk category and patient is symptomatic, then we can test in those patients straight away angiography or CT coronary might be of some help, but not in all patients. TMT is a routine screening tool, but it is not very effective. In 2/3 of patients it picks, but in 1/3 of patients it misses. And we have seen patient with normal TMT reports coming with heart attacks.
Yeah, thank you. Thank you, Dr. Pankaj, for your insight. And my next question is to Dr. Amit Malik. Dr. Amit, this myth is around the symptoms of heart attack. कि chest pain है तो ही heart attack है. नहीं, मेरे को epigastric pain है, मेरे को कंधे में दर्द है, मेरे को jaw में दर्द हो रहा है. तो क्या is the chest pain the only warning sign of a heart attack, or there are other silent indicators which people should watch for? And how true is the belief that heartburn or the gastric discomfort is often mistaken for a heart attack?
So thank you, organizers, for this very healthy initiative. So I'd like to summarize a few things first before going to answer this. We talked about the risk factors, the preventive aspect, the heart disease in women. So if you look at the last 4 or 5 decades of India growth, so there are basically 4 major transitions which we have seen. One major transition is of demographic change. Till 2011, our more than 60% of age, as per the demographic data, was 8%. And it's going to increase by 19% in next coming 20 years. This age is going to add the risk of cardiovascular disease incidences in the society. Second transition which we have seen is the nutritional transition. Our nutrition has changed from majority of the cereals, fruit and vegetables, to a processed food item, more salt intake, which over a period of time is now reflecting in the increased incidence of cerebrovascular accidents. Third transition is socio-cultural transition, which we have observed in last 40 years. From a majority from agriculture, we have shifted to the industry, and that to a mechanized one. Even the agriculture nowadays is highly mechanized. So our level of physical activity goes down drastically in last 40 years. And the fourth one is the environmental transition. On an average, as per the WHO, more than 99% of the world population is living in unhealthy air. In India, on an average, the P2.5 level is 80 to 160, which should be below 5. We talk about prevention. We all know that doing exercise is good for cardiovascular disease. But there are studies that if you do exercise in this unhealthy air environment, it's going to increase the risk of cardiovascular disease. It's not protective. Second, as Dr. Dubey mentioned, about heart attack in women, a rising trend. It's not a myth, it's true. And I would like to share just 3 facts. That it's true that in your premenopausal stage, the women are protected naturally by their hormones against the cardiovascular disease. But if you smoke, you lose that protection and you are 4 to 6 times more at a risk of getting cardiovascular disease. If you smoke and you are taking oral contraceptive pill, then risk is going to increase by 30 times, 30. So your natural protection has gone. Now, I come to the question which you asked me regarding the symptom. There is right from our childhood, even when we are not exposed to any medical education, there was a myth that heart is on the left side. So the pain of heart attack will be there on your left part of the chest. It will goes to the left arm, and then and only you can consider is that a cardiac pain. Otherwise, it could be something else. As per the scientific evidence, the cardiac pain can occur right from your jaw up to your umbilicus, jabde se nabhi tak. This is the basically area, anatomical area of a referred cardiac pain. And believe me, more than 2/3 of the cases, they come with a kind of some upper abdominal discomfort, which they miss as a gastric or gaseous, and they miss the golden hour of cardiac treatment, and they land in a complicated state. So the symptom may vary. People may have only toothache, go to the dental chair. People may have only pain in their elbow, may be treated by simple analgesic for a tennis elbow or any rheumatoid disease. People may have only dyspepsia kind of feeling or gaseous feeling while they walk. So what kind of gaseous feeling you can have while you are walking? If you have these kind of symptoms, get yourself checked. It's okay. It could be gastric. That can be dealt. But it should not be cardiac, because then you are going to miss the golden hour of treatment. And you land in a complicated way. Because cardiac muscles, they do not have power of regenerations. Once they are damaged, they are dead for the lifetime. So it's the golden hour of the first 3 hours that if you can revive them, you can prevent a permanent damage. So early detection of risk factor number 1 and early detection of symptoms is very important. Do not ignore them. Get yourself checked with your healthcare provider.
Thank you, Dr. Amit. I think very rightly mentioned that, chest pain is not the only symptom. We normally, as a layman, people think heart attack to chhati ka darad hi heart attack hota hai. It can be from jaw to navel, umbilicus, as he mentioned very rightly. It can be a simple toothache, shoulder pain or jaw pain. So I think this is very important that we need to recognize the symptoms early as a stakeholder, as a patient, and then secondly, we need to report to the doctor on time and get the investigations done and for further management. So one more thing I would like to tell here is that the government of India has taken a very good initiative. They have started a Screen at 30 campaign, which is a very important national initiative. 30 years and above, everyone should be screened, for the NCDs, for the non-communicable disease and some common cancers. So this is about screening the 100% of population. So, but of course, the key objectives are that early detection. This will of course detect the disease early, and there will be increased awareness, and it will enhance the overall quality of life. So this is something which is a very good and welcome initiative by the government, and of course this is just started, but let's see how it moves. And Lastly, I think because of the paucity of time, I would not, I would just request each of the panelists.
Sir, can I add one thing
before
about
I
the
conclude?
symptoms?
Yes, Dr. Dubey. Yes, please.
It's a 30 seconds only. There are two subsets of the patients who doesn't have the classical chest pain. One, woman, as you rightly said. The women usually, they are presenting with the palpitation, shortness of breath, anxiety, giddiness, syncope-like of things. That's the one subset of the patient. And majority of the times we are just mistaking it. We are saying that, oh, lady है ऐसे बहाना कर रही है, इस तरह का बात. But this is real presentation in the females. That's the one. And second subset of the patients is are old age patient, octogenarians. They are also not presenting with this type of the chest pains. They usually present with a sudden profound weakness. वो चलते रहे हैं, खा रहे हैं, एकदम से कमजोरी आगे उठ नहीं सकते, चल नहीं सकते. That's one. And sudden forgetfulness, sudden confusional states. These three symptoms are common in octogenarian patients. Yeah, they are usually not presenting with the chest pain and all. So these two subsets of the patient, that's what we are calling as an angina equivalent: shortness of breath, palpitation, pre-syncope means giddiness, and syncope. These three things are pre-anginal, having the same value as classical chest pain. So that's what we should always think of that.
Thank you, Dr. Dubey. And I would now request each of the panelists to, give a take-home message to the audience. So with this session ending, concluding, you please share your insight on, what should be the take-home message for the audience.
Thank you. I think the most important message is one, I would summarize what Dr. Pankaj mentioned is know your risk. If you don't know the risk that you have, don't go by the way a person looks. Please go back. If you have a family history of somebody who has had an event, you are at risk. If somebody has a family history of a premature heart attack, then you are at a higher risk. So know your risk. The second is definitely to talk to your doctor. I think the challenge in our country is that patients don't talk. We need more voices to be heard. We need patients to talk to the doctors, ask these questions. So that the second part is more important is that once you know that you have a risk, you'll know where to reach in terms of the target. Sometimes the lab reports may not apply to you. Take example of a person who has had a heart attack. His LDL level may have to be much lower than a person who is normal. And therefore, these things are certainly important. Having said that, also because Dr. Vinayak mentioned about mitochondrial DNA and the concerns that we may be prone to, I think it's important to consider lifestyle. Some of the members earlier talked about mental health. Just one point here, I think very casually we use the term depressed. I'm depressed today. I think we need to shy away and we need to understand the criticality of these words when we use. That's how we will be able to switch and give due importance to mental health as well.
Thank you, Pallavi, because risk factors, they are modifiable and non-modifiable risk factors. Modifiable risk factors to hamare control mein hai. And thank you. Yes, Dr. Vinayak.
So I think the best time to repair the roof is when the sun is shining, which means that you have to preemptively take up all the suggestions which our esteemed panelists have forwarded. The only thing which I want to say, two things which are very important in today's age is, please don't, I would say 99% of what you see on social media is wrong. I can tell you pretty much, on that. Because one, it is unscientific, unsubstantiated. If American Heart Association, Canadian, Indian Cardiology Society of India, they need to come out with telling you that you should carry a sorbitrate in your pocket to prevent heart attack, they'll tell it to you. You would not require some doctor to just come up and tell you that please all of you should get CT coronary angiography done because you should know what your blockage is, without telling you that it's a very high radiation source, you're exposing your kidneys to die, and also the fact that just by doing an angioplasty or surgery in a stable coronary artery disease, you don't prevent heart attacks. So I don't want to know my blockages. I want to make sure that if I have plaques or blockages, they should not burst or should not rupture. So So at the end of the day, it's about lifestyle only. It's about keeping things simple. Don't complicate them. Please don't listen to these, sort of, I call medical extremists who just want to hog some limelight and would propose some really stark, suggestions and statements in the media or on social media, because now it's a free for all. And that's one message which I want to give you. And the last is, I think very, very important, which each of us said, was slow down. I think it's very important to remind ourselves every single day when you get up in the morning, I need to slow down. I need to breathe. I need to take it one day at a time. Don't plan ahead too much. And I think that reflects in your attitude in every sphere. Thank you.
Thank you, Dr. Vinayak. So lifestyle modifications and preventive cardiology is the key. Dr. Dubey, take home message.
I will suggest to remember 6 S for everybody. Were usually 6 S for to remember. These 6 S are for your risk factors. You know that diabetes, hypertension, high cholesterol level, smoking, sedentary habits, and stress. These are the classical 6 risk factors we all of us are knowing. So how to protect them or how to get away with this? So just remember 6 S, letter S. First S is sugar. Since beginning, as early as possible, your kids, yourself, you should avoid taking a lot of sugars and sweets. That's the first S. And second, if you are having a diabetes, take care of that. Second S is for the salt. All of us are knowing the salt is the main culprit thing which increases your blood pressure. Reduce the salt quantity. Just excluding the table salts and salty foods like bhujiyas, chips and other things. So you can reduce the salt by 50%. Just salad वगैरह में डालते हैं उसको छोड़ दो, 50% salts कम हो जाएंगे. Third S is statins. Statin is a drug for the cholesterol reduction. So this aim is to just take less cholesterol as less as possible. Nowadays the people are saying that less cholesterol, even the LDL cholesterol is less than 30, it is okay for you. So reduce that fatty foods and especially processed foods, ultra processed foods, all of them are having a bad quality of cholesterol, so reduce that. The fourth is the smoking. Smoking is the absolutely no for smoking. It does not mean that you are taking 40 cigarettes and now you are taking 1 cigarette and it's going to help you. It's going to help you to little bit, not completely. Why? Because smoking, they are having the 4800 ingredient which is sticking in your bloods, and the effect of smoking goes away in 18 to 24 months. That's the biggest problem with that. Today you have taken 1 cigarette, 10 days after 1 cigarette, so 1 cigarette 2 days and after 10 days, they are additive. They are still remain in your blood for 6 months. So that's the say. So absolutely you have to say no smoking, zero. Zero means really zero. Next is the sedentary habits. All of us are, our previous speakers has spoken about the activities, physical activities. So only 2 things are there. In the healthy individual, not obese one, normal individual, if you go for at least 30 minutes of the exercises, the dynamic exercise, what we are calling as a cardio, that's enough. And not only that, you have to add 15 minutes of stretching exercises, just like yogas and those type of things. That's the stretching exercises. So that is a sedentary habits. So if you go for 150 minutes of the moderate exercise, that includes jogging, walking, brisk walking, stretching, yoga, and all those things, that's enough. So, but not like that in 2 days you go for 75 minutes today and 75 minutes tomorrow and over 150 minutes is over. It's not like that, because the effect of exercise persists in your body for 24 to 30 hours, 32 hours. So every day you have to, if you want to do 5 days, you miss Sunday and Thursday, not like Saturday, Sunday. And last is the what we are calling as a stress. So stress is a really problematic. Dr. Sandeep has told there are 2 factors of stress. One is your boss or your subordinate, another is your wife. So he was suggesting change the boss if it is giving a stress, but I am suggesting change the wife if she is giving a stress. So this is in lighter mood, but definitely yes, you have to change the environment. Stress is the things. And I will tell you 5 things that is very important for reduction of stress. 5, only 5. And this is temporary, not permanent. For acute stress, only 5. Number 1 is socialization. That is a very important. As everybody has stress, because of the corporates and other things, we are not getting time for socialization. That is true. For me, I am going to the hospital at 10 o'clock, coming back from the hospital at 10 o'clock. Where is the time for socialization? So that is, we have to find out time for the socialization. That's many studies has shown that socialization has reduced the incidence of coronary artery disease and heart attack. That is one. Exercise, as we have already discussed. Food, already discussed. And the 4th thing is much more important, is a positive attitude. That's a must. We have to teach our children not to go for the competitive, but have a positive attitude that I'm going to do something better, not my colleague is doing better. We have to, that's the positive attitude to success, that's the important thing. And last but not the least is you have to find out some time for yourself, especially ladies, working ladies, coming to the home, working at office, working at home. They have to find out some time for themselves, some yoga, some exercise, or painting, singing, whatever. These hobbies, these are the 5 tricks to reduce the stress. Thank you so much.
Thank you, Dr. Dubey. You know, the myth about smoking is one of my doctor friend, he's a smoker. He switched on to a patli wali cigarette. Then I asked him that, but you are still a smoker. Kehte nahi, ye patli wali hai, isme tobacco kam hoga, it's less harmful. So this is a myth is happening among the doctors also.
And another
I
thing
think
is
doctor,
vapes. Vapes is actually more dangerous than the existing cigarettes.
Yeah, actually e-cigarettes are banned in India because of various reasons, but it says that it is e-cigarette is less harmful because you're not, it is smokeless, number 1. It is order, कोई smell नहीं होती, कोई smoke नहीं होता उसमें, और उसमें मतलब nicotine से जो आता है जो, that is not, cigarette smoking से तो nicotine से direct आपका effect आता है, but this is something what they say, it's also a myth actually. But lastly, I think I have 2 more panelists to give their last message. So please, because one of the panelists has to leave.
So concluding remark,
very short and crisp. Yeah.
So we are living in a world of AI now, and you have got a lot of technical gadgets with you. So my humble request, you can use them to monitor your health, monitor your physical condition, but try not to treat yourself by ChatGPT. Consult your healthcare provider and get yourself treated well. Thank you very much.
Wonderful. Wonderful. The use of technology. Great. Yes, Dr. Pankaj.
My take-home message will be, take your lives sincerely, but not too seriously. It's okay to fail. Even failure teaches a lesson. Thank you.
So lastly, I would like to thank the organizers, especially Mr. Anil Rajputji for inviting me and all the panelists, and and you all being a very lovely audience. And of course, this session would not have been a very great session without all the panelists here. So thank you all. So my last message is that don't just count your heartbeat. Don't just count your heartbeat, but make every beat count. So thank you so much. Thank you.
Thank you very much. A round of applause for our learned speakers. I request Mr. Anil Rajput, sir, to please join us on stage for the presentation of mementos. We thank all our learned speakers for a very detailed and informative session. Request Rajput sir to please present memento to Dr. Sunil Khetarpal, our esteemed session moderator. Kindly keep the applause going as we now present a token of appreciation to our eminent panelist. Dr. Bipin Kumar Dubey to please step forward. Kindly keep the applause going, ladies and gentlemen. This is our opportunity to thank them all. Dr. Vinayak Agarwal, sir, to please step forward. Dr. Amit Malik. Dr. Pallavi Kawatra. Dr. Pankaj Ranjan. I request all our esteemed panelists to please come together for a group photograph with Mr. Anil Rajput. Kindly step forward and come together for a group photograph. Thank you very much. Ladies and gentlemen, we'll begin the next and the final session for the day in next 30 seconds. We'll quickly prepare our stage again for the same. So we request you all to kindly remain seated. This is the final session for the day, and we'll conclude with a hearty lunch. Our upcoming session is on the theme Role of Preventive Health Checkups, Stress Management and Lifestyle in Heart Care, starting shortly. Rajesh Kesari, Member Advisory Council, Illness to Wellness Foundation and Member National Executive Committee Elect RSSDI. Can we please give him an energetic round of applause? A very warm welcome to you, sir. Thank you very much for your presence. Joining him on this panel are distinguished voices from medicine, wellness and spirituality, truly a 360-degree perspective on heart health. Please put your hands together and welcome Padma Shri Dr. Mohsin Wali, Senior Consultant Physician, Sir Gangaram Hospital, and former physician to the President of India, will be joining us shortly. His Grace Mohan Rupa Das, President ISKCON Delhi. Can you please give him a warm round of applause? A very, very warm welcome to you, sir. Dr. JPS Saune, Chairman, Department of Cardiology, Sir Gangaram Hospital. Kindly keep the applause going. Dr. Vikas Chopra, Interventional Cardiologist, Primus Super Speciality Hospital. Dr. Amit Kumar Chaurasia, Interventional Cardiologist, Artemis Hospital. Dr. Shikha Sharma, Scientific Mentor, Ranfort Wellness. Can you please welcome our esteemed panelists as they get seated on the stage? Once again, a very warm and hearty welcome to all. And I now hand over the session to session moderator Dr. Kesari for further proceedings.
First of all, I would like to welcome everyone once again, and I'd like to express my gratitude to Shri Anil Rajput ji, and huge congratulations to him and to the whole family of Illness to Wellness Foundation. And I think it is my proud privilege to be a part of this family and to see this whole process of Illness to Wellness working up and growing from small camps and organizations to such a big conference. So once again, I would congratulate and request everyone to give a big hand to Illness and Wellness Foundation and to Shri Anil Rajput ji for his great work that he's been doing in this field. Thank you so much. And I think I'm very privileged to have a great panel with me today, and it is a very diverse panel. We've talked so much since the morning about heart diseases, about various aspects of heart disease. I won't delve into that once again. I would try not to repeat things that have already been said. But I would definitely like to take the advantage of this diverse panel that we have. And it is a very well thought of panel because it reflects all the socio-economic conditions and all the factors which actually give rise to the heart diseases and which actually make it occur at such a young age. We've talked about it. 50% of coronary vascular deaths, CAD deaths in our country occur below the age of 50. It is a known fact. 25% of the myocardial infarctions are occurring below the age of 40. So the CAD, heart diseases, one of the major heart diseases, is occurring a decade early in our country, in our population, as compared to the Western population. So we actually do have a huge problem. And we've heard from many learned speakers that we have to tackle it early. It is too late when patients reach the doctor's chamber or the table. So to start early. I think it would be very appropriate for me to start this session with some comments and blessings of His Grace Mohan Rupadas ji. One question which came to my mind when I saw the panel was, do you see heart diseases, heart attacks, because this is something which I'm sure would attract your attention, would be reported to you, you would be hearing about it in students and followers who live in the ISKCON organization, because I understand that there are many young people living there and practicing religion and chanting and Gita. So how often do you come across such incidences in your organization?
We are also within this world, so we are not out of this world. And there are young people also facing a lot of health issues. And of course, somebody who's beyond the middle age, they're also having a lot of problems. Health issues are always there. But we have seen that if there is a regulation, if there is a discipline in the life, then many things are sorted out. If you see the Bhagavad Gita, in the 6th chapter, there is a verse which explains where Lord Krishna is saying, a lot of instructions are there related to health in the Bhagavad Gita itself. It's in the 6th chapter, text 13, where Lord Krishna is saying, Hey Arjun, जो अधिक खाता है और बहुत कम खाता है, जो अधिक सोता है अथवा जो पर्याप्त नहीं सोता, उसके योगी बनने की कोई संभावना नहीं. So we find many verses like this, where the Lord is talking about, speaking about regulation, and then He says, the next verse, जो खाने सोने आमोद प्रमोद means recreation, तथा काम करने की आदतों में नियमित रहता है, वह योगाभ्यास द्वारा समस्त भौतिक क्लेशों को नष्ट कर सकता है. So that means if you are regulated in eating, sleeping and recreation, you can mitigate all the miseries of life. All the miseries of life, not just heart problem. He's saying we can mitigate all the miseries of life if we have schedule in our life, if we are disciplined in our life, if we are regulated in life. And so therefore this regulation is very, very important for our health, good health. So not just heart problem, but any kind of health issues.
Thank you so much, thank you. And what I'm sure all of you would appreciate it. This is more like a medical conference because we are getting references for every course that we are hearing. So thank you so much. That was really wonderful. Now, since the morning, we've talked a lot about the problem, the issue. We know that it is a magnanimous issue, that the number of heart attacks and heart disease is increasing, has increased. But what can we do about it? Can we prevent it? Is it possible? We have heard about that also. So how to start with that? With this question, I would come to Dr. J.P. Sani. I'm sure everyone knows him. He needs no introduction. Sir, what are your thoughts about prevention? What should we be doing? Should we be testing everyone? What should we be testing? Is lipid profile, is it a blood test of choice? What would you like to say, sir?
Dr. Rajesh, I think in your introduction talk, you said about that we are getting disease 10 years earlier. So we wrote the first guideline of lipid for our country, which was published last year, along with 22 cardiologists, and published in Indian Heart Journal. And there we look into the problem of our country. So this guideline of lipid was based on Indian population, research done on Indian population for the first time. That's how we came out of guideline. So there we have discussed a lot about why we are getting disease 10 years earlier. What is the reason behind that compared to the Western world? So one of the factors that we get risk factors of hypertension, diabetes, dyslipidemia earlier compared to the Western world. Then there are certain risk factors which are very peculiar to our country, like central obesity, what we say metabolic syndrome. This is also very common, 2 to 3 times more than the Western world. Third, among the tobacco, we have a unique tobacco problem of chewing tobacco and beedi smoking, which is not there in the rest of the world, besides this cigarette smoking. And finally, what we found was the genetic factor of familial hypercholesterolemia, which is run with the premature history of premature heart attacks in the family, less than 55 for men, less than 60 for women. This history, which is because of the familial hypercholesterolemia, because the genetic defect, is again very common in our country compared to the rest of the world. And another thing what we found was another risk marker, lipoprotein little a, is a very important risk factor which we have found now, again much more common in our country compared to the rest of the world. And finally, the lifestyle problem of our country, which in the morning everyone has discussed about the lack of physical activity. We are 192 countries data, we are 15 from below in physical inactivity, you can imagine. And similarly, the dietary habits, which Dr. Shikha will be discussing more detail, I think, that is also a problem. Faulty cooking method is there, and being a vegetarian population, we found that a lot of us also having consumption of high carbohydrate food. Now coming to so these are the causes why we get disease earlier. The second thing is which investigation should be done. In our guideline, we published that the first lipid profile should be done at the age of 18 when a child goes from school to the college. In the form which he fills up for the admission should include his blood pressure, his sugar, and his lipid. You see, blood pressure has some symptom, sugar has some symptom, lipid has no symptom. It is just a true silent problem for the community and straightway takes you to the CCU. So that is again issue. So in our guideline, we also suggested then fasting state for lipid profile is no more required in most of the patients. Non-fasting lipid profile is good enough because the HDL cholesterol, good cholesterol, the bad cholesterol, LDL, non-HDL, they are not affected by fasting versus non-fasting stage. The only thing which gets disturbed is a little bit of triglyceride by around 25 to 30 milligram. Because of this recommendation, the number of people getting lipid profile will increase. This is what we saw in our hospital. We started 6 years ago. 22 to 24% increase in lipid profile came because any time of the day, person can come and get his lipid profile. He knows his LDL cholesterol, which is very important marker. That is another thing. Then we have also discussed with our general public, what should, like for example, bad cholesterol, what should be the normal level? The normal level should be, for the general public, should be less than 100 milligram of LDL. For a patient who is suffering from hypertension, diabetes, or any risk factor, should keep it below 70, not 100, below 70. Because what we learn that arteries, when they get blocked, it is the LDL cholesterol which enters, who pushes hypertension, diabetes, smoking, and stress. They push it inside and they cause the blockage. But the common denominator is LDL. So keep it low. And those who have got heart attack, heart disease, or stroke, they should keep their LDL cholesterol below 55 milligram. So that is the way we should do. The diet's role in cholesterol probably is little less. It's around 15 to 20%. 80% is genetic, manufactured by the liver for the given patient. That's why family history of premature heart disease is very, very important. Whenever anybody getting a family heart attack in a younger age, their children, their brother, sister should get their lipid profile to find out it may be a genetic disease running in the family. Because most of this carrier of the genetic diseases are asymptomatic. and they will also get disease early in life. To prevent that, they get the lipid profile and we try to treat them by lifestyle modification or by adding statin drugs. So I want to say the lipid is the most important risk factor of which is ignored in the society.
So, sir, are there any such recommendations or any current practice that when you have a patient, a young patient with an MI or heart attack, then his family, like his children, are recommended to undergo a lipid profile?
Yes, that's what I said.
Or his brothers and sisters?
Yeah, that's right. So that's what we have learned. The importance, our colleague was discussing, the commonest risk factor about the women, for example, they were saying, is a woman is smoker or woman is diabetic, her protection from cardiovascular disease is taken away. She is equal to men, even in premenopausal state. So what we suggested that for the patient who has got, for example, I will give you an example yesterday. There is a family who came to me from Gwalior, 38-year-old person who had a heart attack. We had to put a stent. He came for follow-up. First time he came 6 months ago. His younger brother died at the age of 32. His father died at the age of 47. And they have only one child, 5-year-old boy. So then we started looking into this. So then the wife was very intelligent. She Googled and she said, Doctor Saab, my child is also has to be protected. So what we should do? I said, to get a lipid profile. So for 5-year-old boy, we did a lipid profile and found 239 LDL. His father had 241. So he also has 239. We did a genetic test which came positive, LDL receptor positive. So that means this child is prone for premature heart attack, what his father and his uncle got it. So what to do? We have to put him on statin. This 5-year boy, I have to put him on statin. There is no answer for that. So that's what we say. If a premature history is there, if he's not a smoker, if he's not a diabetic, and he's getting young heart attack, think that it is genetic. And if you think it is genetic, familial hypercholesterolemia, then go for lipid profile of his brother and sister and his children. And from there we'll pick up the number. Those who are having above 150 LDL for adult, above 135 LDL for child, then he is a carrier. And we should treat them even in a younger age, above the age of even people say at 5 years, we should start them on to prevent the future disease.
Thank you, sir. Thank you so much. One more very common disease and which is associated with heart diseases and hypertension is diabetes. So majority of the patients that we have with diabetes are type 2 diabetes, and it becomes more so important because almost 60% of mortality in diabetes is due to cardiovascular diseases. That means that people with diabetes, they actually don't die of their own death, they don't die of diabetes, but they die of myocardial infarction or stroke. So they have to be more so particular about preventing such diseases and taking action earlier. So with this, I would like to come to Dr. Mohsin Wali, sir. First of all, welcome once again, sir. And sir, I would request your esteemed opinion on other major risk factors like diabetes or what you consider to be important that we should be looking forwards to for prevention of cardiovascular disease, and especially for early prevention, not wait till the event has already occurred.
Thank you, and thank you, Illness to Wellness Foundation, very enthusiastically done by Mr. Anil Rajput and his team. And I was amazed to listen, Rajput Saab, your lecture in the morning. You did not leave any corner to be untouched. You covered everything. And I was thinking after your lecture, what is the need of further deliberations? You covered it so very well and so thoughtfully. Now, what I feel, if you ask me, I give lecture 2 to 6 is my clinic to everyone coming on 2-3 things. First, sir mentioned is stress. The society is undergoing tremendous uncalled for stress which we have never seen in the past. And there are various reasons about it which are beyond the scope of talking here. And you said very rightly, diabetes. Diabetes is also a disease due to stress, which I have recently felt. I would not hide, or I would not be saying that it happened with me. 8.5 years after I debuted the office of Mr. Pranab Mukherjee, I was not able to do exercise. 8.5 years. And this is for use of everyone in this hall and outside. And I thought I'll do it tomorrow. And the time, my routine would not allow me any time in between. Then one day I thought very sincerely, what is the time which I can keep for my exercise? That was 8:30 when I reach home, up to 9:30 when I'm at dinner table, 1 hour. I booked a trainer and he comes daily, and 4.5 months on my patch, which I'm still wearing, 5 days back it started showing levels below 57, below 55, and I could not correlate it. Why it is happening? I'm eating same food, I'm doing same breakfast. Unfortunately, I have no choices, much choices. So it made me to think the breakdown in my diabetes towards the cure is only after exercise. Sustained exercise, 6 days a week I'm doing. And this I found as a great message to myself. And I was so happy that all we practice is probably a hoax. The treatment, newer insulins, that tirzepatide-like drugs, excitement of weight reduction, Shikaji, diet and exercise. These are the two important things which can prolong our life. I was just taking a lecture in HelpAge, which was delayed, and so I was delayed to reach here. And I told them, age is not age word. आप इसको जरा ध्यान से अंग्रेजी का एक्सेंट छोड़ के पढ़िए, इसको आगे है ये, AGE आगे, and they were amazed to see my interpretation. It came to my mind while sitting in that hall of IAC. So what we are seeing is something very different. Smoking is one, stress is other, and junk food is three. These are the things which are probably responsible for all these syndromes which included in the metabolic syndrome, जो जननी है, hypertension की, diabetes की, heart disease की. And Dr. Talwar was pointing out towards this don't miss a beat. And recently I wrote an article, दिल तो पागल है, एक गाना था ना, तो वाकई में जब हमारी हार्ट बीट इरेगुलर हो जाती है, डॉक्टर साहब वुड एग्री विद मी, वेंट्रिकुलर टैकीकार्डिया का जो ईसीजी है विद टॉपिक्स बिल्कुल ऐसा ही लगता है, वो ईसीजी जैसे एक पागल दिल का ईसीजी, और पेशेंट हमें 10 मिनट देता है और मर जाता है अगर हमने उसको इंटरवेंशन सही नहीं किया. तो ये जो चीज़ें हैं ये बहुत इम्पॉर्टेंट हो गई हैं. वेट गेन, जिसको हम ओबेसिटी कहते हैं, खाली वेट गेन नहीं है, वो यहाँ भी जमा होता है, अल्जाइमर से उसका रिलेशन हो गया. वेट गेन से एथेरोस्क्लेरोसिस तो है ही, डॉक्टर साहब ने भी बताया. ये इनका ओरिजिनल रिसर्च है गंगाराम में, बहुत हम्बली डिस्क्राइब कर गए उसको. मुझे मालूम है इन्होंने कितना 8 साल तक एफर्ट किया है, और हमने ये फाइंड आउट किया है कि कॉलेज गोइंग एज में फैट मैनेजमेंट ऑफ द ब्लड, जिसको हम लाइपिड प्रोफाइल कहते हैं, करना चाहिए, विच इज़ वेरी लॉजिकल. हम सब चीज़ चेक करते हैं कॉलेज गोइंग एज में, सारे कागज़ वेरीफाई करते हैं, लेकिन हम उस बच्चे का, उस बच्ची का कोलेस्ट्रॉल नहीं देखते हैं, और पैरामीटर्स नहीं देखते हैं, ब्लड प्रेशर नहीं चेक करते हैं. संदीप ने कहा कि 1 घंटा लगता है स्कूल में जाने में, अगर हम 3 महीने में 1 घंटा ये चीज़ चेक कर लें, शुगर चेक कर लें, ब्लड प्रेशर चेक कर लें, वेट चेक कर लें, और पॉसिबली कोलेस्ट्रॉल चेक कर लें. मेरे एक दूसरे दोस्त ने इस पे मेरिट में रिसर्च की, और उन्होंने इसको बड़ा अच्छा नाम दिया, आप सब लोग याद रखिएगा, लाइपिड पासपोर्ट. सो लाइपिड पासपोर्ट मीन्स पासपोर्ट टू एंटर द कॉलेज विद ए गुड हेल्थ. और सर ने वो मेरे दिल की पीड़ा थी जो बताई कि स्कूलों में से लॉन ख़त्म हो गए, बल्कि स्कूल बंगलों में आ गए. लॉन कहाँ से आएगा? बहुत बड़ी ट्रेजिडी है ये. और मोहल्लों में जो खाली प्लॉट पड़े रहते थे, वो स्कूल ग्राउंड बने रहते थे, वो भी ख़त्म हो गए. अब तो इंचों के हिसाब से ज़मीन बिकती है. तो ये जो बड़ी ट्रेजिडीज़ हैं ये हुई हैं. और सबसे इम्पोर्टेंट, कल शाम को मैं सोच रहा था कि यार ये सिम्टम की बात करते हैं लोग, हार्ट के अर्ली सिम्टम, अर्ली डायग्नोसिस, हम कैसे कैच कर लें, हार्ट अटैक होने जा रहा है. So my assistant was writing, I was missing that paper here. I said, first is symptom you write, number 1, no symptom. No symptom is the first symptom. It has no alarm, that's why 23 साल के बच्चों का बाईपास हो रहा है. डॉक्टर तलवार ने कभी अपनी जिंदगी में नहीं देखा था कि 23 साल का बच्चा आ रहा है उसके स्टेंट लगाने पड़ेंगे, जो अब हो रहा है. क्या हो रहा है? It's all because of our stress, our change in the diet pattern, and our being couch potato mannerism, and no exercise, and subsequent development of hyperglycemia, then weight gain. I'm sure I have to cut short. He's seeing me repeatedly. It's lunchtime. So this message is very important. When you go from this hall, please monitor what your children are getting at 2 o'clock in the night by Swiggy or Zomato. There's no harm in taking these brand names. They are doing bad thing to our society. And how they are paying online, and morning what you happen to see is an empty box of pizza, or an empty box of some fast food. This is tragic. This is tragic. For that one box, that child has to run 10 miles to digest. So my message is very clear, that our recent mannerisms which we have acquired in the modern society have to be scrutinized and to be motivated towards a good and greater cause, and spiritual training of our children should be done. Very important. The youngsters are not getting spiritual training, and I always say that our ego, show of strength, arrogance, lust, desire, क्रोध, काम, लोभ, मोह, ये जो पुरानी चीज़ें पढ़ाई जाती थी, इनसे दूर रहना ही हार्ट का इलाज है. दिल बीमार हो जाता है इन सब चीज़ों के साथ, और उसमें सबसे बड़ी है ईर्ष्या. ईर्ष्या सबसे बड़ी है. और इसमें मैंने गीता का एक श्लोक लिखा है बरकत के लिए, और आज बरकत के दिन आजकल चल रहे हैं उसके लिए मैं उसको पढ़ने की आज्ञा चाहता हूँ. राजपूत साहब. अहंकारम बलम दर्पम कामम क्रोधम च सर्षिताः मामात्मा परादेहेषु प्रद्विषन्तो भयसूकाः. यानी जो हमारे अंदर अगर ये चीज़ें अल्टर कर जाएंगी तो हमारे अंदर जो अच्छी क्वालिटीज़ हैं, जो डेडिकेशन है, डूइंग गुड टू अदर्स है, थिंकिंग पॉजिटिव है, स्लीपिंग एट राइट टाइम है, डूइंग गुड टू अदर्स के साथ साथ अपनी कुर्बानी देके दूसरे के लिए अच्छा करना है, ये क्वालिटी जब निकल जाएंगी तो हमारी लाइफ ऑटोमेटिकली शॉर्ट हो जाएगी. थैंक यू वेरी मच.
I want to just say, today morning's Times of India, you must have read, 1/3 of the children are having lipid disorder. It's because of the rising trend of obesity, which is there in children now.
Thank you, sir. So, would carry on with the prevention and screening. We have esteemed cardiologists with us. So, I'd like to ask, let's start with Dr. Vikas Chopra. So, what should be a good screening protocol? What should we be screening? Let's say, what tests should be done? And I would request you to focus on resource constraint. Because, you know, we have a good audience here, we are sitting in a 5-star hotel, but what should be the focus for the larger part of the country? What should we be doing?
Thank you, sir. Thank you for this invitation. And I think it's a wonderful initiative. And since we have a World Heart Day coming on 29th, so educating people about heart health, because that is the basic thing. Heart health doesn't just mean heart, it means cardiovascular health. It means diabetes, it means hypertension, it means all the related illnesses. And the indication for screening basically takes us to what are we screening for, and in what age group and in what patient population. So if we are thinking of screening, we should know what are the risk factors. So as Dr. Sani has just mentioned, that the process of atherosclerosis starts early. It starts as early as in infancy. We have autopsy data where they have seen that the atherosclerotic plaques, even in healthy individuals who have died of accident or something, their aorta carries significant burden of atherosclerotic plaques. So the process starts from infancy and it keeps on accelerating through the young adult, adulthood and the older age groups. So the screening also has to be targeted towards that. Now, what are the other risk factors? Now, one of the risk factors is obviously cholesterol, which is basically the value which we measure. But cholesterol is not a single value. We have various types of cholesterols. We have the LDL cholesterol, small dense LDL particles. We have VLDLs. We have various other atherogenic indicators which we can measure. We have lipoprotein A, we have homocysteine, all these factors. So first of all, we have to see that what is the target population which we are looking at, and then we screen accordingly, tailor it according to the population. If, for example, we have a young person, a young child, adolescent comes to us with, let's say, hypertension, a young hypertensive, then we screen accordingly. We look at the secondary causes of hypertension. We look at whether does he have, in addition to hypertension, other risk factors like familial homozygous dyslipidemia, which can predispose him to early onset of coronary artery disease. Does he have markers of early onset diabetes, type 1 diabetes or type 2 diabetes? So this is the way we screen if a person presents to us in a younger age group. A person comes to us in a middle-aged person in 30s, 40s, maybe 50s, hypertensive, comes to us with symptoms, chest pain, atypical chest pain or breathlessness. Then we do the whole gamut of tests. We take the person and we do the, the blood investigations, which includes the lipid profile, the blood sugar, the kidney profile, the liver profile, the thyroid profile, the whole thing. And then we do the heart-specific tests. So what are the heart-specific tests? So these are the tests which include an ECG, which is basic electrocardiogram. We do an echocardiogram to screen for his heart muscle function. We do a treadmill test to see whether he has an inducible ischemia. So these are the basic tests. Then if the person has a higher indication of coronary artery disease, and if the stress test turns a bit suspicious, then we screen for further processes. So in that we have two types of screening tools. Either we can do a CT coronary angiography, which is currently a lot of people are undergoing, or we can do a normal coronary angiography. Both have their pros and cons, and both have their own strengths and limitations. So this is how the screening process works. In a resource constrained setting like as we have, obviously we cannot screen everybody for exotic markers like lipoprotein A or homocysteine or ApoB polymorphism or familiar homozygous dyslipidemia. So we have to do the basic tests. We have to go at the basic level, do the blood pressure, the body weight, the obesity, the BMI. BMI is a very simple test which we can do at any age group. And then we do the basic blood work, which includes lipid profile, sugar and others. So, but the message should go that this process has to start early. Like you mentioned, somebody mentioned lipid passports. I think that is a very good idea. If we start implementing that in a college going age group, then one, the message will go across that yes, this thing is important. And then if the values are there and if they come off to a certain degree, then of course the person is aware and how the person has to take care of it. So that's a very good idea. So my take-home message is that yes, screening is very, very important. Prevention is always better than cure, and it should start as early as possible.
Thank you so much. That was all very important. And now to Dr. Chaurasia, sir. So, considering that we are talking about the early age of onset of such diseases, is there any role of universal screening?
Thank you so much for having me over here, and it's great to discuss all these things. I can tell you from morning I have been listening about prevention and heart disease and all those kind of things. You cannot have a universal screening for everybody. The basic is, you can have prevention, but you cannot screen everybody. It's not, in a way, monetarily it may not be viable. So, when you start talking about preventing a disease, you will have to first find out the population that requires attention. And once you have that population, then depending upon that population, you are going to design a test, a battery of tests or a small number of tests, and then after that you are going to, take care of those tests and then move forward. That is the most, monetarily viable way of going. We have been hearing about prevention is better than cure since morning, but I think this whole population, if you see, we all are old populations. Is there any new population, young population sitting out of there? Very few. Whom are we talking to? I think these programs should be held for people who are meant for. So if we mean to target our younger generation, they should be among the audience. It's the same way, like once I was giving a talk on intervention, and then I started saying that these kind of talks are meant for a young generation who want to learn intervention and not for people who are already seasoned operators sitting out over here. The same thing is going over here, I think. We should go into the...
We would come to the prevention aspect. Right now we are talking about screening, because we have 2-3 topics that we need to cover. So who should be screened? I would just request 1 more minute, and I would request contribution of all the doctors here, that what should we know what we have to screen about if we consider a resource constrained setting. What are basic tests that should be done? I'm not going to talk about HSCRP, little a and all. So could you start, sir? What could be the basic tests? Let us have quick...
You see, the screening for the recommendation where we use guidelines, when for our country we have reduced the age limit. Now around 20-30 years we should go for screening. Although we said 18 years for all the 3 risk parameters, but you are asking for investigation. So I will say definitely basic, you have to, simple tests like CBC, kidney function test, liver function test, lipid profile, thyroid profile, HbA1c. And in lipid, I always say now, at least once in a lifetime, lipoprotein little a. LPA should also be included in that. So these are the basic tests we normally do for any patient who comes to our clinic with one risk factor. For example, patient comes to me with hypertension or comes with diabetes. So we have a duty to look for other risk factor in that patient. So the absolute risk reduction is the way to go. So I think this basic test should be done for any patient who comes to you in your clinic, that this test should be done to look for other risk factors, because most of the risk factors probably do not have any symptoms. So you can check the blood pressure in the clinic, you can check the sugar also in the clinic. Lipids, you need to have a test for that. Point of care testing is now available, we can do that. So I think basic tests should be done for every person, but I think the most important thing is the anthropometer, like for example, the central obesity is important. Look for that, because we are getting so many children now with obesity, getting their blood pressure in a young age. Today's paper says 5 to 9 years old child are having 1/3 people having high lipids. That is an alarming figure for our country. So I think counseling the patient about lifestyle is also very important, besides prescribing a drug. So basic investigation should be done.
I think that's very important. The metabolic syndrome and inflammation part is what Dr. Sani has just touched upon, because this disease and many other chronic diseases actually start with inflammation, with chronic inflammation, and the intra-abdominal fat is the root cause of that, and this is very important. And the basic tests I think that we've talked about are the blood sugar test, lipid profile test, blood pressure. These are some very simple and very, very important things which can be literally done anywhere in country, even in villages and in small towns, and they at least form a background from where we can step on further. Next, I would start the topic of prevention And this I would like to start with you, ma'am, because perhaps the most important part that we have discussed since the morning, since you've been there, in the very first sessions, is the diet part of it. So we are what we eat. So let's start with you. Please give an opening remark about the role of diet and its prevention in heart diseases.
Firstly, I'd like to thank Illness to Wellness Foundation for inviting me and putting my experiences, which I'm still learning. So, as part of our Ranfort Wellness, we have worked with few lakh patients, particularly in lifestyle disorders. And what is very interesting is, my journey into prevention started actually from the ICU, because I was working as a young doctor in the ICU at GV Pant Hospital and hoping to become a cardiologist at some point. But as I would say, as your, and since His Grace is sitting here, I would say that there is always a inner North Pole which guides you and shows you the direction in your life. So I decided to work in prevention instead of pursuing cardiology. So thank you for inviting me here. First, I want to clear some myths, because when we talk about prevention, we must know what are we going to be working on, what is the action plan. So as a doctor trained in science, as a doctor who was trained in anatomy, physiology, biochemistry, which was the toughest subject, the biochemistry, the first thing which I discovered in nutrition is that the calorie concept is unscientific. It is not created or relevant to the human body, because the calorie concept was created on machines, and the human body uses metabolism and not combustion. So first, I would really request that let's get rid of the calorie concept if we really are looking for human health. The second thing which I want to clarify is that when we are looking at obesity, when we are looking at a disorder which is so common in our society, we immediately jump, because of the wrong concept of calories, into let's make the person diet. Let's make the person eat less. That's the saddest thing which is happening today, because obesity is a manifestation not really of people eating too much. It's a manifestation of the gut health gone wrong, number one, the liver health gone wrong, number two, and the whole metabolism and the hormonal imbalance has gone wrong. When the whole communication system of the body is getting affected, the end result is obesity. And therefore, it should not be treated with dieting. It should be treated with correction of these three vital areas where obesity starts. Another thing which is very common, initially it was, of course now we have inflammation which is being understood, is when I first did a project with escorts, it was kind of, we thought in our minds that if a person is obesity, the cholesterols will be high. And if the person is slim, the cholesterols will not be high. And we were surprised, because in escorts we saw very slim, very fit, retired generals with heart disease, with high cholesterol. And at that time it was a surprise for us. We also saw very obese patients in my clinic who had no high cholesterol, absolutely normal lipid levels, which means something else was the variable factor affecting, which we did not understand at that point of time. And that is why when we started looking at solutions for our patients, looking at these factors, we also had to go into Ayurveda to understand what do the Vedic studies talk about. Now, as you said initially, that we are what we eat, that's fantastic, because in the Vedic studies, the body is just one part of the human. And the body is called Annamaya Kosh, which fundamentally means the entire body, from your eyes to your brain to your liver to your kidney, the raw materials, the construction material is food. Now let's fast forward to what's happening today. If in our bodies a lot of chemicals are entering, whether it is through preservatives or through artificial colors, through artificial aromas, tastes, the aroma market is, and the taste market, artificial. I mean, we give our children vanilla ice cream. is the vanilla real vanilla? It's a chemical. And these chemicals are entering our bodies and disrupting the communication systems. And once the communication systems are completely disrupted, it is a war inside our body, which we understand as inflammation. So we have to stop the war and not treat in isolation. If this war is stopped, of chemical war happening inside our bodies, the rest of the things can be taken care of. So when we talk about, I mean, of course, everybody knows fruits and vegetables and amla and fiber and millets. But do we need the fruit with pesticide? Do we need a processed, ready-to-eat package which has already been processed with oils which are chemically processed? So today, if we look at the number of oils which are circulating in the market, we'll be shocked to know how many chemicals are there in the oil. So I think, like somebody asked me that malnutrition should be treated with good nutrition. I said no. Malnutrition has to be treated with clean drinking water. Start with water. Our body is 2/3 water. And in the rural areas, where you don't provide clean drinking water, giving proteins and vitamin supplements will not help the child. So let's start with science and common sense married together. And that's where I think the solutions will really emerge.
Thank you, ma'am. That was very interesting. Thank you so much. I would now like to come to Holy Grace, sir. You know, I had a very interesting experience recently in this year during the Mahakumbh. We organized a camp in the Mahakumbh in Prayagraj, and we screened almost 40,000 people for diabetes, for hypertension, and we distributed medicines there free of cost. We organized a camp there. So it was an eye-opening experience for me. It was a great experience for the organizations which actually took active part and organized it, because we saw a great opportunity there to do mass screening at one place. So Holy Grace, I would like to ask you, does ISKCON and your organization consider such mass screening, sir? So perhaps, sir, what I wanted to ask you was, what is the outlook of organization like ISKCON to participate in health programs for the benefit of society? Do you do, or would you like to consider even taking cue from today's discussions, having some mass screening programs in the ISKCON temples which have lakhs of devotees? Just as I was telling that we organized a diabetes screening camp at Mahakumbh in Prayagraj, where we screened more than 40,000 people in one camp, both for diabetes, for hypertension, and we have some very good data from there. And we found the prevalence of heart disease. We found people with heart disease not taking medication. We found people with hypertension, uncontrolled hypertension in large numbers. So all that can actually be translated for the benefit of the society. So how do you see the role of ISKCON in such a position, sir?
Yeah, we do organize such camps, and we invite many medical units to come and have their camps. Recently we had a camp for blood pressure, blood sugar. So they regularly come to our temple campus and they have their whole setup. And thousands of people, devotees, they come and take advantage of that. So that's a very nice step, to do. And not only in one, we have more than 350 centers in India. So all over India, we have this whole scheme to invite, different organizations and do this kind of, this social service. So that we do, regularly we do.
Yes, definitely. It is very interesting that religious organizations, I think, can play a great role in taking active part in prevention of such diseases, because Indians, we all visit temples and are devout followers, and whatever comes out of the mouth of the the purohits and the preachers is actually followed by the population. And if a small message of health and prevention is given in the mandirs, in the temples, and I'm sure people are definitely going to follow that. And I think it is high time that diabetes, heart disease, cholesterol, this also becomes a part of the preaching good healthy lifestyle, which would definitely be followed all over the country by all of the population.
I just want to read out the three verses, very, very important related to health, spoken in Bhagavad Gita by Lord. This is in the 18th chapter, which is text 7, 8 and 9. 8, 9 and 10. So I'll just read out. जो भोजन सात्विक व्यक्तियों को प्रिय होता है, वायु बढ़ाने वाला, जीवन शुद्ध करने वाला तथा बल, स्वास्थ्य, सुख तथा तृप्ति प्रदान करने वाला है, ऐसा भोजन रसमय, स्निग्ध, स्वास्थ्यप्रद तथा हृदय को भाने वाला है. Then another verse, 9th verse, same chapter. अत्यधिक तिक्त, खट्टे, नमकीन, गरम, चटपटे, शुष्क तथा जलन उत्पन्न करने वाले भोजन रजोगुणी व्यक्तियों को प्रिय होते हैं. ऐसे भोजन दुख, शोक तथा रोग उत्पन्न करते हैं. And then another verse is there, which says, खाने से 3 घंटे पूर्व पकाया गया, स्वादहीन, वियोजित एवं सड़ा, झूठा तथा अस्पृश्य वस्तुओं से युक्त भोजन उन लोगों को प्रिय होता है जो तामसी होते हैं. So he is explaining 3 kinds of food liked by 3 kinds of people, and this is a good analysis for ourselves. We can do self-assessment like this, which kind of food we like and how we should improve ourselves in eating habits.
Thank you, sir. Thank you. So what I would be doing now is I'm going to change a little bit the format of our discussion, because we are running short of time and there are so many things that I would like to discuss and take opinion of our esteemed panelists. I would put up questions and request whosoever wishes to address them to come forward. So one thing I want to ask is primordial prevention. Someone said in the morning from the dais about the importance of primordial prevention, primary prevention and secondary prevention. So in diabetes, we already are making efforts towards primordial prevention. Our association has started this, and illness to wellness is also looking towards working with this. So any one of you would like to say anything about primordial prevention in cardiovascular sphere?
Just like charity begins at home, this primordial prevention also begins at home. So first thing, my message always to young generation, somebody was trying to find out, we are all young here, there's nobody old here. And the healthiest and youngest person is sitting in front of you. You can see energy. He is a model of good health, his wife too. Because he practices. And I can tell there's a proof, he won't eat in this rack. You can see and find out when he is eating. So eating healthy is the first primordial prevention, and this should be given from the school. Dr. Chaurasia ने जो बात कही, राजपूत साहब इस पे काम कर रहे हैं. If you would have come in the last session, you would have been very happy to see hundreds of school children whom we are sending this message very successfully. तो ये घर से ही होगा. घर का खाना, शिखा जी वुड एग्री, घर का खाना जो आज एक स्लैंग वर्ड बन गया है, जो तिरस्कृत वर्ड बन गया है, उसको हमको वापस जाना पड़ेगा. और सिंपल टेस्ट जो आपके दिल का दर्द है ना, मैं समझ रहा हूँ राजेश जी, आपके दिल का दर्द और राजपूत साहब के दिल का दर्द बड़ा क्लियर है कि हम एक हेल्दी सोसाइटी का निर्माण करें, किसी भी पद्धति से करें, किसी भी धार्मिक रीति से करें. आई एम वेरी हैप्पी टू सी हिज ग्रेस हियर. He can do a lot to the society, and he is himself is an embodiment of good health. तो मैं इस दर्द के साथ यही कह रहा हूँ कि हम सबको एक ऐसे समाज को विकसित करना पड़ेगा जो पाश्चात्य संस्कृति की तरफ हमारे बच्चों को ले जा रहा है. And they are dying young, which has never happened, and which never happened in our society. So thank you very much for organizing this, and I pray that with these good days we should go ahead and हम वध करें बीमारियों का, हार्ट डिजीज़ का, और विजय पाएं उन पर, जैसे कि हम आगे चल के अगले 4 दिनों के बाद करने वाले हैं. थैंक यू वेरी मच.
थैंक यू सर. So primordial prevention is very important because these diseases don't start even at the age of 14 or 15 that we were talking about. They actually start in the womb of the mother. जब बच्चा गर्भ में आता है, जब वो 10-15 दिन का होता है, तब इन बीमारियों की नींव रखी जाती है और ख़ास तौर पे इंसुलिन रेजिस्टेंस और ऐसी कुछ परिस्थितियां पैदा होती हैं, उत्पन्न होती हैं, जिसकी वजह से आगे जाके उस बच्चे को वो सब बीमारियां शुरू होती हैं जो 14-15 साल की उम्र में होती हैं. So what we have started and we are going to do further on, you are going to see the results of that. We have started educating these young girls who are going to be the future mothers of this country and this society. So this is what we are going to do for primordial prevention, and we have already started doing that, and I think that is going to show effects in the coming generations. So this is what I meant by the primordial prevention here. I would take up very specific topics. In prevention, let's start with ghee. So desi ghee has in the modern times been considered to be a culprit, but we've been having desi ghee since ages, because we used to make this desi ghee in our homes, those who had cows or who are from villages or small towns. So what is the opinion of esteemed panel? Because we have some very good people to answer this question.
So, so desi ghee basically in Ayurveda is called a vehicle, and so a lot of medicines are given along with ghee or honey because they are the vehicles which can travel deep into the tissues. So which means if it's such a powerful vehicle, it should be eaten in limitation, because you can't overdo it. It'll block the shrotas, which is it'll block the microchannels. Second thing, even more important, is that it should be organic. You cannot have chemical desi ghee, you cannot have adulterated desi ghee and not have problems later. And third thing which is very important is, how are you cooking it? I still remember there was a patient in GB Pant hospital who, after his cardiac arrest, after 1 month he came and very proudly said कि डॉक्टर साहब अब हम कुछ भी घी में नहीं पकाते, मेरी मिसेज ने पूड़ियाँ भी ऑलिव ऑयल में पकाना शुरू किया है. So we should know that frying desi ghee is not going to help us. It has to be limitation.
Thank you, sir. Would you like to contribute?
Shikha ji ne bilkul theek kaha. So what we have with our research last 1.5 to 2 decades have come to a conclusion which we incorporated in our guideline is simple, that sugar and high carbohydrate diet causes more heart attack than a small quantity of desi ghee type of unsaturated fat. This is proven beyond doubt in the evidence from the clinical studies, which was a big study done called Pure Study, where we participated and found the answer. The answer is very simple. For the general public, I'm not talking about the person who's suffering from heart attack or who's suffering from familial hypercholesterolemia, where the levels of cholesterol are very high, where we have to limit their cholesterol. One thing you must remember, the source of cholesterol, the LDL, is only animal product, because the LDL manufacturing is from the liver or animal cells, not in the plant kingdom. So anything which comes from animal kingdom, milk, egg or meats, will have cholesterol. Number second, plant kingdom will have 0 cholesterol. Let it be kaju, kishmish, akhrot, badam, or fruits, vegetable, nuts, or soya product, everything. Everything has got 0 cholesterol. So you can have kaju, there is nothing like that, it has cholesterol. The second part is that the diet's contribution for cardiovascular disease is only 15 to 20%. Coming back to my statement that sugar causes more heart attack compared to the small quantity of saturated fat. What the dietary plan have shown that in your diet plan for calories, 50% should be only from carbohydrate. In India, probably because of people that are consuming much more carbohydrate, which is turned into a sugar, what we say. And that carbohydrate has to be reduced to 50%. The fat in the fat, saturated fat, as Shikha ji has said, the desi ghee comes under that saturated fat. 7% is allowed even for the heart patient. So what we have learned that if you, a general public, consume small portion of saturated fat, a small quantity like chapatis with ghee or some paratha with little bit of makhan or something, ghar ka bana hua, this is allowed even to the heart patient. Because what we have learned, if you're consuming small portion of saturated fat, your LDL will go up, because it is the ghee butter is a milk product. It has got LDL. LDL will go up, but the HDL will also go up. The good cholesterol will go up, the bad cholesterol will go up. The ratio between LDL and HDL remaining same, and the size of LDL is slightly larger. But if you consume too much of sweets, like sweet and sugary beverages, type of things, fruit juices and other limca and all those things which are coming up. Sweet and sugary beverages or high carbohydrate diet, lot of rice, lot of vegetable, a lot of chapatis, lot of potatoes, high carbohydrate, fried pizza, pasta, whatever we take. Those high carbohydrate diet, sweets, and all mithaiya, whatever we consume in the country, we are having more. They will increase triglyceride. The moment triglyceride goes up, the HDL, good cholesterol, will come down. Since this vegetarian product has got no LDL, so LDL number remains same, but the LDL size becomes smaller because of high TG. The HDL becomes low, so the LDL and HDL ratio is changed. So the ratio is changed, the LDL becomes smaller, it enters into the formation of blockage of artery much earlier than small quantity of desi ghee, where the ratio is remaining same and the size of the LDL is larger. So sugar causes more heart attack compared to a small quantity of desi ghee or butter, what we say.
Very true, sir has raised a very, very important point here. And I would further like to add to it that our body is very good at storage. So if we have lot of sugary drinks, juices, sweets and refined carbohydrates like pizza, pasta, just as sir was mentioning, it is actually stored by our body. It is stored in the liver as fat. It is stored over and above the heart. It is stored above the pancreas as peripancreatic fat. And this is what adversely impacts the heart health. This is what later on would lead to the heart attacks and the blockages. So it is very important to regulate the diet. And I think one of the very important steps that we have seen that Ministry of Health and Family Welfare has done is that they've issued a directive to schools that they should place a board on the canteen that high sugar drinks are harmful and these are the drinks which have high sugar content. So we have to, again, as Dr. Chaurasia was mentioning, it is very important for us to start with children. And we already see some very good steps being taken in the society by both the government and obviously by all of us. So, Dr. Shikha, to you, sir has already mentioned about the harmful effects of animal proteins. We've had a number of studies which have shown the benefits of plant-based proteins. So how important are plant-based proteins, plant-based diet? He has already mentioned a little about it. Would you like to add something?
Yes, absolutely. See, firstly, we must understand that it's not a debate about vegetarianism or non-vegetarianism. It's a debate about how your body handles food, how your body digests food, and that is very important. When we look at a plant-based diet, the end inflammation in a plant-based diet is much lesser, and of course it has to be organic. You cannot have chemical infused and processed foods. I'm leaving that out because that will cause inflammation. So a plant-based diet a lot of research has been already done. It keeps the gut bacteria healthy. The more plant-based diet you have in the natural form with its fiber and organic, your gut bacteria will be healthy. The gut is the second brain of the body, we all know that. And nobody but wonders why should the gut be given so much innervation? I mean, why should the gut have so much of nervous system? That is because the gut is your first gateway where plant genome or animal genome is interacting with the human genome. And that is why your immunity, your Pierce patches are also sitting in the gut. So whatever you're eating is being scrutinized, scanned, and that information is going to your brain and to your immune system. In a plant-based system, the allergens are much less, if you really see, barring the nuts, but the propensity to cause allergic reactions and further deterioration is much lesser. Secondly, what we've already discussed is that when we have a plant-based diet, and even if you're having badana, I'm so glad Dr. Sahni has corrected that myth, because most heart patients refuse to eat badam because they think calories. Fat, no badam. That's not correct. Badam is good for your health. It has a lot of benefits in terms of a nutritional value. Again, in plant-based food, a lot of bodybuilders and gym goers, and this I want to clarify right now, that a lot of people think that if you have a plant-based food, you will not get good protein, you will be weak. Indians are weak because they have a lot of vegetarian food, or Indian diets are weak because they have a lot of vegetarian food. This is totally incorrect. There is enough research being done and published that vegetarian diets can lead to star athletes, provided you know what to eat. You cannot be eating rajma chawal every day and become a star athlete. And there are enough researches out there. I would recommend let's read those researches and learn from them. And finally, I would say that when we talk about plant-based diets, it is again an assessment was conducted in one of the schools in the US, and the study was saying that how much vegetables the kids are eating, and the end result came out, and this is why I'm talking about study design should be also correct and commonsensical. The study design was such that the results came out, 100% of the American kids were having lots of vegetables. And they went back and said, not possible, let's check the study design. And you know what were the two vegetables they were eating? Potato and ketchup. So the study design did not understand that the kids were writing potato and ketchup as vegetables. So it's important to, with a pinch of salt, understand the research designs and what has been left out, what has been included, what is the population, because sometimes they can get wrong also. I mean, this I'm saying because there was a study done in one of the New York universities saying coconut can kill. And we all know that in India, coconut oil is consumed across the south. So coconut can kill, how did the research come out? So that's where I would say that let's look at with a pinch of salt and our Indian common sense.
Thank you. Thank
gut
you so
sense,
much.
as I would say.
Thank you. And talking about gut, I think you've touched upon a very important topic. There are more than 1 trillion bacteria living inside us. So it is a whole universe inside us. We consider ourselves to be our owners and human beings. No, we are not. There's someone else living inside us, and it is very actively participating in all the processes that we are undergoing, and especially the disease-causing processes, the inflammation that we've talked about. So this vegetarian diet with its fibers, it is a good prebiotic. It provides space and the right environment for those good, healthy gut microbiota to thrive, to survive, which actually are going to ultimately help us in future health, not only heart health, but good health as such. Anyone would like to comment upon the role of exercise and what exercise we all could do, let's say adults?
Just on a lighter note, you mentioned about vegetarianism and the elite athlete performance. So we have our own Virat Kohli and Novak Djokovic, who have been performing at the elitist of levels with vegetarian diet. So the role of exercise is very important, and as Dr. Wali was mentioning initially, just by exercising, you can, you keep a glucometer strapped to yourself and just see after a few weeks of good exercise, the blood sugar comes back to normal. It's like magic. So what happens is that when you exercise, all your tissues, all your cells basically, they consume more of oxygen. The cellular metabolism undergoes a fundamental change. That's what happens, and that in turn influences all the other metabolic activities of the body. So I would say that for cardiovascular health, exercise is the best medicine. It is it's available, it's free, anybody can do it, doesn't cost anything, and it gives you a tremendous benefit.
How long and what? Like in diabetes, we give some specific recommendations, and who should not be exercising?
So our American College of Cardiology recommendation is 3.5 hours of exercise per week. That works out to around 45 minutes of exercise every day. So that is the minimum. Of course, you can exceed that. And who cannot exercise is basically people who are decompensated, who are unstable, a recent MI, maybe decompensated heart failure, accelerated hypertension, it's very clear. But a stable patient with stable heart disease, a stable blood pressure, and stable parameters can very well exercise.
Thank you so much. I think we had a very enriching and a very interesting discussion, and it's already getting late, and we have a panelist who has a flight to catch.
One question. I have a question for Mr. Shri Rupat Tasri. I recently attended a master class on Art of Living by Ravi Shankar in Taj, very recently, 2 days. It has actually changed my perspective towards life. And, it's all controlling your mind, body, and your spirit. So I think you, as a spiritual, person, how do you say that, that spirituality, it does improve all aspects of your health, because the WHO definition of health is not only physical but mental and social and spiritual. So, and have you measured anything? Because healthcare is outcome, the treatment in healthcare, quality of healthcare is measured by the outcome. And have you done any studies, has ISKCON done any studies on how does it help the overall well-being of a person, your spirituality?
So what our experience is that, as per the scriptures, we see that the root cause of all the problem is our mind. It all starts with the mind. If you see in the Bhagavad Gita, the 6th chapter, it says, Lord says, जिसने मन को जीत लिया है, उसके लिए मन सर्वश्रेष्ठ मित्र है, किंतु जो ऐसा नहीं कर पाया, उसके लिए मन सबसे बड़ा शत्रु बना रहेगा. So, see, when we talk about meditation, what is the purpose of the meditation? The purpose of the meditation is to control the mind. And when the mind is in control, the mind is stress-free, you will see the organs are functioning properly. This IBS we say, irritable bowel syndrome. One of the root causes of IBS is stress. It all comes from the mind. And too much pressure on the mental stress, too much mental stress, it can cause heart problem. It increases our blood pressure also. So this is the benefit of spirituality. So when we practice spirituality, what happens is, it really cools down our mental stress. It reduces our stress, and it improves our concentration. And at the same time, when we take care of our diet also, which is very, very sattvic, and we also do basic exercises also, that keeps our body fit. That keeps our body fit, and we also, we don't get into all bad habits also. So in that way also, we like, doctor, he mentioned about smoking also. We don't smoke. We don't take any non-veg, right? So these things we avoid, which can really affect the health. So for the basic health, regulated diet is very important, regulated exercise is very important, and we need to do some kind of meditation so that we can reduce our mental stress, and when we do that, we will see our health will really improve. Hare Krishna. Yes.
So I think we had a very interesting and engaging session, and since we are running out of time and our panelist has a flight to catch, I would like to conclude the session here. And I'm very thankful to the audience and to all my co-panelists who were here and who contributed so much to this discussion. Thank you. And a big round of applause for everyone here.
Thank you very much. That was a stimulating discussion we just had. I request Mr. Anil Rajput to please join us on stage for the presentation of mementos. And for your questions, you can connect with our speakers offline during lunch. We request our delegates to please remain seated during the presentation of mementos as a matter of respect to our esteemed speakers. We'll begin with session moderator Dr. Rajesh Kesri. Presently, we're giving it to Padma Shri Dr. Mohsin Waliji. Thank you very much, sir. We now present it to the session moderator Dr. Rajesh Kesri to please step forward. Kindly keep the applause going. His Grace Mohan Rupa Das to please step forward. Kindly keep the applause going. Dr. JPS Sane, sir, to please step forward. Dr. Vikas Chopra. Dr. Amit Kumar Chaurasia, sir, to please come forward. A round of applause, ladies and gentlemen. Dr. Shikha Sharma. Dr. Shikha Sharma, requesting Mr. Rajput to present it to Dr. Shikha Sharma. And I now request all our esteemed panelists to please come together for a group photograph. Kindly come together for a group photograph. We once again thank you for your gracious presence and for your expert insights. Thank you very much for sharing them with us. Thank you very much. Ladies and gentlemen, with this, we conclude our awareness conference on heart care. We thank you all for your participation and support, and we request you to please join us for lunch. Thank you so much. We wish you a great day ahead.